We're using way too many platforms for work. We should just use Monday.com.
We're not using that many.
You keep me wondering, is our love strong? Just like a love song, baby, it's haunting me. Don't know what you're thinking, it's like I'm sinking deep underwater. Maybe it's harder for me. Oh, harder for me. Maybe we're over it, or maybe just lovers, 'cause under the covers, baby, you're showing me how to be fearless, no one can hear us. You're throwing the pillars to the floor. Now put your loving on me. Hey, loving on me. Maybe you won't see me get emotional, and sometimes I pretend I'm just above it all. But I want you lying next to me. Yeah, I want your body too. Yeah, body too. And baby, please don't think I run away from you. It's just sometimes I get scared to dive into it. I want you lying next to me. Yeah, I want your body too. Yeah, body too. Will you be my ride or die? Around all these people, try to be someone better than you and I. Posing for pictures, but nobody listens to anything that you have to say. Can we just leave and walk away? Walk away, walk away. Maybe you won't see me get emotional, and sometimes I pretend I'm just above it all. But I want you lying next to me. Yeah, I want your body too. Yeah, body too. And baby, please don't think I run away from you. It's just sometimes I get scared to dive into it. I want you lying next to me. Yeah, I want your body too. Yeah, body too.
Back at me. I don't know what happened. Guess we weren't meant to be. I know we had problems. I thought we could fix them, but we got tired. There's nothing left to do but to say goodbye and try to move on. I'll get over you, only wish that I knew how to go on. Baby, you and me, we're so messed up together. Even if we tried, we'd be stuck here forever. I don't understand right now how to make it through, but I'll get over you. And it's not like I'm gonna hate you. It's what it is, nothing left that we could do. Even though it hurts right now, we will make it through. I'll get over you. I'll get over you. When I met you, we were like fireworks. Thought nothing could break us, but oh how we got burned. Look at us now, we scream, we fight, and no one knows the reason. We're both getting out of line. Now say goodbye over you. Only wish that I knew how to go on. Baby, you and me, we're so messed up together. Even if we tried, we'd be stuck here forever. I don't understand right now how to make it through, but I'll get over you. And it's not like I'm gonna hate you. It's what it is, nothing left that we could do. Even though it hurts right now, we will make it through. I'll get over you. I'll get over you. We were holding on to something that we both know couldn't work, so we should try to say goodbye. You know we had our problems, so now we have to try to move on. Baby, you and me, we're so messed up together. Even if we tried, we'd be stuck here forever. I don't understand right now how to make it through, but I'll get over you. And it's not like I'm gonna hate you. It's what it is, nothing left that we could do. Even though it hurts right now, we will make it through. I'll get over you. I'll get over you. Oh, I'll get over you.
Say you think about me, because I'm starting to doubt we will find our way back to each other when you're on the other side of the world. I'm here and I'm waiting, but I know I can't say that we didn't end it for good reason. Still I'm hoping we'll be meeting soon. Everybody needs some time to figure themselves out, but I want you close, and I still have hope. I'm waiting every day for you to come back and tell me we can work it out, forget about the past. Now time moves slow. I'm not high or low, no, I'm somewhere in the middle and a little bit messed up, 'cause without you everything stops. I'm feeling so lonely when you never phone me. I put your picture on my windowsill to make myself feel alright, but I knew it would not be easy spending time apart, and I almost can't believe it. Believe that you're gone, and I don't think this will get better until you come around. I guess that everybody needs some time to figure themselves out, but I want you close, and I still have hope. I'm waiting every day for you to And I know sometimes I'm bringing you down, but I always make you smile, don't I? We're like the waves on a big blue stormy sea, but still you're the one who brings out the best in me. We're a little messed up, baby, kinda up and down, and we keep falling till we hit the ground, but then we get back up again. Yeah, we're a little messed up, baby, it's never getting boring when we keep aiming for the stars, just you and me. We always get back up again, you and me. Baby, you and me. There's no one else who can make me feel like I can do anything I dream of but you. We can fight all day and make love at night, 'cause we always figure it out, don't we? Yeah. We're like the waves on a big blue stormy sea. We're a little messed up, baby, kinda up and down, and we keep falling till we hit the ground, but then we get back up again. Yeah, we're a little messed up, baby, it's never getting boring when we keep aiming for the stars, just you and me. We always get back up again. You and me, you and me, baby, you and me. You always leave me wanting more, baby, you and me, we're like the perfect storm, and you know that I can't get enough of you, no. Yeah, we're a little messed up, baby, kinda up and down, and we keep falling till we hit the ground, and then we always get back up again. We're a little messed up, baby, kinda up and down, and we keep falling till we hit the ground, but then we get back up again. Yeah, we're a little messed up, baby, it's never getting boring when we keep aiming for the stars, just you and me. We always get back up again. You and me. First time I ever saw you, I fell in love when you entered the room. And when the light hit your face, we were just kids, but I knew right away that I will be with you until I stop breathing. I will keep loving you as long as my heart's beating. Oh, hold me close, promise you won't let go. I'm nothing without you, I don't know what I would do without you. You are the one I choose, I wanna grow old with you. I'm nothing without you, I don't know what I would do without you. Even though years have gone by, I'm still in love with the way that you smile. And when I look in your eyes, I know that I will be with you the rest of my life. I will be with you until I stop breathing. I will keep loving you as long as my heart's beating. Oh,
first time I saw your face, I fell in love. Oh, I can't believe you are mine. I'll never let you down. I'll never let you down. Oh, hold me close. Promise you won't let go. I'm nothing without you. I don't know what I would do without you. You're the one I choose. I wanna grow old with you. I'm nothing without you. I don't know what I would do without you. Do without you. Do without you. You. Do without you. You. Do without you. You. Do without you, 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 do without you.
Morning, everyone. Am I loud and clear? Okay, good morning, everyone. While awaiting the start of the activity, I will share on your chat box the link for the attendance. Kindly register your attendance through the link. Thank you.
Secondhand, I felt a bit forgotten. Not your plan, but now the days of silence outgrow the fun things we have done. But tell me, do you wanna carry on? Plants don't grow without water, and they cave when it's cold. We could go till we're older. Put your head on my shoulder and let's enjoy the ride. When we started, our wishes aligned.
need someone to save me. No, and don't come running to blame me. From miles away, I can tell that something's off. The way you look and how you pause when you talk, I think I said enough. You said your love for me something brand new. You said this is something you would never do. Here we are in your car. Let me see who you are, who you really are. Yeah. Don't need you here to say you're sorry, 'cause if you're gonna leave me, then just do it. Don't take it slow, don't be gentle. No, I just gotta know, if you're gonna leave me, then just do it. Let's be honest for a second. Yeah, you're being over your head, babe. 'Cause there is no one other than me that can make you feel the way you feel when I hold you. I think I said enough. You said your love for me something brand new. You said this is something you would never do. Here we are in your car. Let me see who you are, who you really are. Yeah, don't need you here to say you're sorry, 'cause if you're gonna leave me, then just do it. Don't take it slow, don't be gentle. No, I just gotta know, if you're gonna leave me, then just do it. Just do it. Don't need you here to say you're sorry, 'cause if you're gonna leave me, then just do it. Don't take it slow, don't be gentle. No, I just gotta know, if you're gonna leave me, then just do it. I did a lot of bad things, and never did I give in. Just 'cause the thought of being vulnerable made me feel less than I am. I have never felt home till you entered my door. And from that moment I knew that a home is whatever you choose. That's the thing about you. The best thing I did, and I want you to know, was letting you in. From that moment I knew that you were all I missed. Baby, it took just one kiss. 'Cause here in your arms I can finally let go. The rest of the world is outside when you make sure I'm all you've missed. Baby, it takes just one kiss. Many years have gone by, many tears have dried out. I know that I will be with you as long as you still want me to. All the things we've been through, everything that's been takes just one kiss. The best thing I did, and I want you to know, was letting you in. From that moment I knew that you were all I missed. Baby, it took just one kiss. 'Cause here in your arms I can finally let go. The rest of the world is outside when you made sure I'm all you missed. Baby, it took just one kiss. I feel it coming, I feel it taking control. It's the hurt I imagine from us to nothing. There's something missing you stole, and it's a little tragic. I know I'm better off living without your love, but time and again my thoughts go back to when we were crazy kids with a lot of feelings. I'm too proud to beg and too numb for stealing. When I rode with you it was all downhill, and losing control was a part of that thrill. A part of me still wants you. A part of me still wants you. I've got my own place, an extra toothbrush as well, for someone you don't know of. But these are long days, and even though you can tell, there's something I can't get over. I know I'm better off living without your love, but time and again my thoughts go back to when we were crazy kids with a lot of feelings. Too proud to beg and too dumb for stealing. When I rode with you it was all downhill, and losing control was a part of that thrill. A part of me still wants you. 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 We were crazy kids with a lot of feelings. Too proud to beg and too dumb for stealing. But when I rode with you it was all downhill, and losing control was a part of that thrill. A part of me still wants you. 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 I know the sign was given. It's in the way you move and in the sound of your heart. We tend to fall together, fall in love, and still in the end we'll fall apart. So it's hopeless that we stay close, but it's the life that we chose. It takes time to get it right.
Sleepless days and nights, we just need a little more. Just a little time for you and I. So stay a bit longer. Just a little time for you and I, until it's over. Just a little time. I think that we got blinded, 'cause when it's good it's great, so we can't see we're fading away. So it's hopeless that we stay close, but it's the life that we chose. It takes time to get it right. Sleepless days and nights, we just need a little more. Just a little time for you and I. So stay a bit longer. Just a little time for you and I, until it's over. Just a little time. Just a little time.
We were made for each other, to hold on to. I was carved out of redwood beneath your moon. I was birthed in the mountains under the sun. Something's changed, you can't see my face in the crowd no more. Something's changed, you can't see my face in the crowd no more. We are living the dream together, out here on the road, and our love takes center stage.
In a land blessed with natural beauty and rich cultural heritage, the Filipino spirit has endured countless challenges navigating through the winds of change. Our journey as a nation has been marked by progress, resilience, and the unyielding pursuit of a brighter future for all. As we step in a new era, the health and well-being of every Filipino takes center stage. The Philippine Department of Health presents its 8-point action agenda for the years 2023 to 2028, a transformative path towards a healthier, more inclusive society. Bawat Pilipino ramdam ang kalusugan. Every Filipino will feel the swift implementation of the universal healthcare through accessible primary healthcare services. Integrated healthcare networks will unite public and private institutions, fostering a seamless approach to health services. Ligtas, dekalidad at mapagkalingang serbisyo. Our commitment extends to better health centers and integrated healthcare networks, catering to tuberculosis, HIV/AIDS, dengue, and other diseases. We ensure the health and well-being of our youth, women, and children. teknolohiya para sa mabilis na serbisyong pangkalusugan. Interoperable electronic medical record systems will revolutionize healthcare, enabling prompt payments to doctors and real-time epidemiologic data. Hospitals and clinics will have the freedom to choose EMRs that comply with their high standards. Handa sa krisis. We will build advanced capacity for mass casualties, displacement, and evacuation logistics in all health facilities. From the start, we will prioritize sustainability, ensuring that our health facilities are environmentally friendly.
Walang i-share di wala na i-share di Rebe. Ano kasi na Sir June?
Pag-iwas sa sakit, emphasizing vaccination, diet, and physical activity, we create healthy cities, islands, and schools. A community-focused approach prevents the spread of diseases, safeguarding the well-being of all. Ginhawa ng isip at damdamin. We embrace a holistic approach to mental health, incorporating art and culture for healing. Our aim is to comfort minds and soothe emotions, fostering a society where mental well-being thrives. Kapakanan at karapatan ng health workers. We prioritize the welfare of our health workers, working towards higher pay, better recognition, and clear career pathways. From local government health staff to the Department of Health, their contributions are valued and celebrated. Proteksyon sa anumang pandemya. We fortify our defenses against pandemics through a dedicated pandemic preparedness center, enhanced training, and facilities for infectious diseases ensure that we remain vigilant and ready. Each heartbeat, each dream, and every smile matters. We cherish the lives of our fellow Filipinos, recognizing that all lives are important. As we build a healthier and more compassionate society, we hold this truth close to our hearts. Because when we prioritize the health of our people, we forge a nation that knows no bounds, a nation that thrives. Sa bagong Pilipinas, bawat buhay mahalaga. A new Philippines, every life is important. In a land blessed with natural beauty and rich cultural heritage, the Filipino spirit has endured countless challenges navigating through the winds of change. Our journey as a nation has been marked by progress, resilience, and the unyielding pursuit of a brighter future for all. As we step in a new era, the health and well-being of every Filipino takes center stage. The Philippine Department of Health presents its 8-point action agenda for the years 2023 to 2028, a transformative path towards a healthier, more inclusive society. Bawat Pilipino ramdam ang kalusugan. Every Filipino will feel the swift implementation of the universal healthcare through accessible primary healthcare services. Integrated healthcare networks will unite public and private institutions, fostering a seamless approach to health services. Ligtas, dekalidad at mapagkalingang serbisyo. Our commitment extends to better health centers and integrated healthcare networks, catering to tuberculosis, HIV/AIDS, dengue, and other diseases. We ensure the health and well-being of our youth, women, and children. Teknolohiya para sa mabilis na serbisyong pangkalusugan. Interoperable electronic medical
Okay, good morning to each and everyone. So we still have 1 minute left before we start the activity. Again, flashing on your screen is the attendance link. So kindly register your attendance. You may scan the QR code flash on your screen, or you may click on the link provided on the chat box. Thank you. Good morning once again. It is exactly 9 a.m. already in the morning, so we will begin our activity. To begin with, let us start today's activity with a prayer to be followed by the national hymn and the DOH hymn.
Our ever-loving Father, the core of every reason, the source of truth. You who made the earth and the heavens are the ultimate goal of every knowledge seekers, the infinite wisdom, the cause of all that is good. We are truly grateful for this opportunity to gather together as a community despite the challenges we face each day. Yet you remained and gave us strength to carry on the responsibilities of bearing intelligence and using them for better purposes. We now humbly ask you to join us in our endeavor to explore the wonders of life in the world for knowledge's sake, that in whatever we learn today, we become more grounded to you, who is truth, who is love. We pray that you bless our speakers, the fount of your infinite knowledge, that they can share something worthwhile despite the limited time we have. They can channel all they know and share to us the beauty and truth of living as your child. We pray that you guide our participants, the seekers of your boundless knowledge, that they may continue to persevere in the search and be deemed worthy to share what they learn from today's session. Sanctify us, O Lord, not because we are worthy of it, but because we believe in your love and mercy, that at the end of the day, we can take home something that's amazing and meaningful. This we ask and pray through Christ our Lord. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, ewas ng silanganan, alam ng puso, sa dikit mo'y buhay. Lupang hinirang, kuya ka ng magiting, sa manlulupin, di ka pasisingil, sa nagagang tutok sa simoy at sa langit mong pangaw, ay nilatang tula, kawin sa pagkayang minamahal, ang isang ng di magdidinig. Lumalang araw ng walang pagsinta, buhay langit sa piling mo. Ang ligaya ng pagkay mga amin, ang mamatay ng dahil sa'yo.
In a land blessed with natural beauty and rich cultural heritage, the Filipino spirit has endured countless challenges navigating through the winds of change. Our journey as a nation has been marked by progress, resilience, and the unyielding pursuit of a brighter future for all. As we step in a new era, the health and well-being of every Filipino takes center stage. The Philippine Department of Health presents its 8-point action agenda for the years 2023 to 2028, a transformative path towards a healthier, more inclusive society. Bawat Pilipino ramdam ang kalusugan. Every Filipino will feel the swift implementation of the universal healthcare through accessible primary healthcare services. Integrated healthcare networks will unite public and private institutions, fostering a seamless approach to health services. Ligtas, dekalidad at mapagkalingang serbisyo. Our commitment extends to better health centers and integrated healthcare networks, catering to tuberculosis, HIV/AIDS, dengue, and other diseases. We ensure the health and well-being of our youth, women, and children. Teknolohiya para sa mabilis na serbisyong pangkalusugan. Interoperable electronic medical record systems will revolutionize healthcare, enabling prompt payments to doctors and real-time epidemiologic data. Hospitals and clinics will have the freedom to choose EMRs that comply with their high standards. Handa sa krisis. We will build advanced capacity for mass casualties, displacement, and evacuation logistics in all health facilities. From the start, we will prioritize sustainability, ensuring that our health facilities are environmentally friendly. Pag-iwas sa sakit. Emphasizing vaccination, diet, and physical activity, we create healthy cities, islands, and schools. A community-focused approach prevents the spread of diseases, safeguarding the well-being of all. Ginhawa ng isip at damdamin. We embrace a holistic approach to mental health, incorporating art and culture for healing. Our aim is to comfort minds and soothe emotions, fostering a society where mental well-being thrives. Kapakanan at karapatan ng health workers. We prioritize the welfare of our health workers working towards higher pay, better recognition, and clear career pathways. From local government health staff to the Department of Health, their contributions are valued and celebrated. Proteksyon sa anumang pandemya. We fortify our defenses against pandemics through a dedicated pandemic preparedness center, enhanced training, and facilities for infectious diseases ensure that we remain vigilant and ready. Each heartbeat, each dream, and every smile matters. We cherish the lives of our fellow Filipinos, recognizing that all lives are important. As we build a healthier and more compassionate society, we hold this truth close to our hearts. Because when we prioritize the health of our people, we forge a nation that knows no bounds, a nation that thrives. Sa bagong Pilipinas, bawat buhay mahalaga. A new Philippines, every life is important.
Good morning once again. I am Ms. Jeremy Arangas, Nurse 1 from the DOH CBCHD Health Facility Development Section and your moderator for today's activity. So despite your busy schedules and deliverables, no, kay end of the week, we would like to thank each one of you who are with us virtually today to attend to this equally important activity. To officially start today's activity, please help me welcome our most fervent Medical Officer 4 and Head of Health Facility Development Section, Dr. Sharon Adzanet O. Laurel, for the opening remarks. A warm virtual applause, please.
Oh, thank you, Ma'am Mimi, and good morning, everyone. I hope I am heard loud and clear. So, welcome to the first teleconference for HFDU programs for 2024. So, in behalf of our regional director, I would like to extend our gratitude for your time spared this morning. So, thank you also for your cooperation and participation in the DOH programs. Only with your active support, we will attain the universal health care and ensure that every Filipino achieves the highest level of health. So for this morning, please allow me to emphasize the importance of the Health Facility Development Unit of the Department of Health, as some may have a little confusion with the Regulations and Licensing Enforcement Division or RLED. So apparently in the previous years, mag-monitoring, there are mga facilities nga mahibong, no? Nga bago pa man mo gi-visit sa RLED, na nasa ilaim mo communicate, nga naay mag-monitor. So that would be our HFDU team, no? So while the RLED requires the minimum standards for licensing, no, nga needing nyo i-comply, the HFDU is tasked to monitor every health facility's operation and management. And the HFDU also is the one the unit that provides guidance, no, for improvement. Now, that is why we encourage all facilities to have action plans for continuous quality improvement. No? So, under na siya sa ang atong pag-monitor, no, your operations, no, in the facilities. And we also challenge everyone to utilize every program nga the HFDU cascades, no? Like the client experience survey, no? So, amo anang disseminate sa inyo ha. I hope nga every time you submit the report, it is not just for compliance purposes, no? But you also have to utilize the data you're able to gather in your facilities for your facilities improvement, no? So, and other nga mga programs nga i-cascade nato nga need for implementation, no? So always bear in mind nga all this, no, we ask you to implement for your improvement, no? And of course, to increase your client satisfaction um, in all your facilities, no? So I hope that is clear, no? Wala na yung mangutana nga nganong kadaghan man mo ari sa among facility ang taga Department of Health, no? So the monitoring that we do for HFDU is really to monitor how your facilities have improved, no? Based on the previous monitorings that were done. Huh? So also this morning, the HFDU is blessed to be given, no, another medical officer 3, no, by the office. No, we appreciate the support of our office in providing us a medical officer 3. We have Dr. Margot Papas. No, she will be delivering later the closing remarks. No, with this addition in our unit, no, we are assured of an enhanced, no, effective and proficient monitoring together with our ever hardworking staff na. So with this, I'd like to thank you again for your participation this morning. And then I hope you will be focused, no, because we will be giving out mga updates, and we will also be having a brief orientation on a new tool, particularly in iHome, that will be utilized for this year. So thank you again, everyone, and have a pleasant day ahead.
Okay, thank you, Dr. Sharon Laurel, for that very heartwarming and encouraging opening remarks. No, again, like what Dr. Laurel said, that we aim to implement the HFDU programs not only to for compliance purposes, but this is to improve the quality service that we provide to our clientels. So before I move on with the house rules, I would like to acknowledge the presence of our participants. So we on board, we already have 174 participants across the region. So we cannot call each one of you, no, but we are very grateful for your presence to this activity. So may we have a thumbs up from our representatives from the province of Bohol? Can we have a thumbs up, please? Okay. How about representatives from the province of Cebu? Okay, good morning, everyone. And then representatives from the facilities from the province of Negros Oriental, can we have a thumbs up also? Okay, and last but not the least, can we have a thumbs up from the representatives from the facilities from the province of Siquijor? Okay, I would also like to acknowledge the presence of the medical officer from Badian District Hospital, Dr. Don Porfirio Ferolin. We also have our chief of hospital from the Toledo City General Hospital, Dr. Abjel Can Espera. Good morning, Doc. We also have Medical Officer 4 from Mandawi City Hospital, Dr. Annabella Sevilla. We also would like to acknowledge the presence of the Medical Director of Ramiro Community Hospital, Dr. Edgar Pizaraz, as well as the Medical Officer 3 of Amio Community Primary Hospital, Dr. Antonio Vincoy Jr. Good morning, Doc. We also have Medical Officer 3 from Camp Lapu-Lapu Station Hospital, Dr. Danilo Gallardo Jr. We also have the Medical Specialist 4 from Vicente Soto Memorial Medical Center, Dr. Helen Valenzuela Madamba. Good morning, Doc. From Dr. Edelfonso Alcantara, we have with us Dr. Insonacion Alcantara, the medical director of Dr. Edelfonso Alcantara. We also have with us our medical center chief from St. Anthony Mother and Child Hospital, Dr. Juanita Chu. Good morning, Doc. And Dr. James Nicolas Hobahib Naharo from Bantayan District Hospital, as well as Dr. Marcelina April Gonzaga from Vicente Soto Memorial Medical Center. Again, to all chief of hospital, medical center chiefs, medical directors, hospital administrators, medical officers, chief nurses, as well as admin officers and other representative from the hospitals and infirmaries in Region 7. Good morning once again, and thank you for sparing your valuable time in attending to this activity. Moving forward, we will now discuss the house rule so that we will ensure a smooth transition of today's activity. We we would like also to acknowledge the presence of the representative from Galyares as well as Siquijor province. Please don't forget to register your attendance so we can acknowledge you properly. Okay, for our house rules, to start with, we encourage everyone to ensure that a learning conducive environment free from unnecessary noise and interruption. And we request everyone to kindly turn off or mute your mic during the discussion proper. For the attendance, we have posted a while ago the QR code, but we also posted in the group chat the link for the attendance. So kindly register your attendance. Okay, please change your username to the following format. First, your facility name, and then followed by your name or the name of the participant or representative. For your questions, kindly reserve your questions until the discussion of our presenter is done. You may type in your questions in the chat box or in the Google link provided later. And then you may also sound off during the open forum. Okay, again, for those who have not yet registered their attendance, kindly scan the QR code flash on your screen or click the attendance link found on the chat box. Okay, may I have a thumbs up to verify if I am loud and clear? Because other facilities are, they have complaints of audio difficulties. Okay, thank you everyone for verifying that. Okay. So in line with so to start with, the Universal Healthcare Law seeks to progressively realize its intention to extend quality care to all patients, both in public and private health facilities, without causing financial risk and hazards. In line with this, all representatives from hospital and infirmaries in Region 7 are enjoined in today's virtual activity for the updates of hospital-related processes and procedures in accordance to the given standards issued by the DOH Health Facility Development Bureau. So to start with, to discuss the updates on Hospital Client Experience Survey, let us welcome on this virtual platform the ever-talented songbird of DOH CBCHD and the assertive nurse one of Health Facility Development Section, Ms. Marie Hope Cinco. A warm virtual applause, please.
All right, thank you so much, Mimi, for that introduction. A beautiful morning to each and every one. I am Miss Marie Hope Cinco, your program coordinator for Integrated People-Centered Health Services. So before I proceed with my presentation, allow me to again welcome our participants for this first quarter teleconference and HFDU program updates. And of course, we'd like to acknowledge also your presence this morning and for your continued support to the DOH program, especially the HFDU programs through attending this quarterly teleconference. So for this morning, I'll be presenting the updates for the Hospital Client Experience Survey on the status of submission for the second semester responsiveness report for calendar year 2023 through the Health Facility Profiling System and the cascaded IPCHS responsiveness report submission for the second semester CY 2023 crafted by the HFDB. So in reference to the DM number 2023-0244 or the implementing of the 2023 Health Facility Profiling System in all government and private hospitals, infirmaries, and PCF, under the implementing guidelines that all hospitals and infirmaries are directed to submit their reports for HSES through encoding all responses to the IPCHS module in the Health Facility Profiling System, and that would serve as their annual report in compliance to the DM 2023-0131 or the Harmonized Hospital Client Experience Survey. The submission of the report would be on or before January 15 of the succeeding year. So this DM was already cascaded to all health facilities last year, so it is expected that all responses for the client experience survey of the second semester, that would be from July to December, must be encoded in the system. So, however, upon checking the system, there are still health facilities that were not able to submit their responsiveness report for the second semester. So here is the list of the facilities with no submission for government and private hospitals of Region 7. Let's have first the Bohol province. We have 8 facilities out of 27 total number of health facilities. Kindly refer na lang to the screen, so I will not be reading it one by one. Refer to the screen and see if one of your facilities among the health facilities with no submission. So we have there 8 from Bohol province. For Cebu province, there are 18 facilities with no submissions out of the 63 total number of health facilities in Cebu province. So we have also private hospitals na wala nakasubmit. For Negros province, Negros Oriental province, there are still 5 facilities with no submission out of the 20 total number of health facilities. And luckily for Siquijor province, they only have 2 facilities there and they were able to submit their report to the health facility profiling system. All right. So as to the facilities with no submission, especially those government hospitals, it is mandated again by the DOH in pursuant to the Department Memorandum on the implementing guidelines that DOH hospitals and other government hospitals are required to implement and utilize the HS tool, while for private facilities, they are much encouraged to utilize the tool to measure responsiveness in all health facilities. So also per RA number 11032 or the Ease of Doing Business and Efficient Government Service Delivery Act of 2018 and under Section 3 of the Rule 4 IRR of the Act, that all agencies shall embed feedback mechanism and client satisfaction measurement in their process improvement efforts. So I'd like to acknowledge those private facilities as well, know that they were able to implement and utilize the HS tool as their customer feedback mechanism. For that, we hope that those facilities with no submission, they would start implementing and utilizing the HS tool, as this promotes a harmonized and standardized framework in measuring client satisfaction across all health facilities in Region 7, and also to ensure continuous improvement and enhancement of service promise towards a more meaningful, client-centered services, and as well as also to respond to the needs of the client no visiting in your facilities through their customer or client feedback. Now, with all the submitted reports across all the regions in the Philippines, the Health Facility Development Bureau crafted the summary of the second semester responsiveness report for the calendar year 2023. So this infographic summary report was already cascaded to all health facilities last February 26, no, that is Monday, through your respective emails. So, sig naka-check na mo. So this report seeks to provide information on the overall responsiveness of health facilities in meeting the needs of the clients following the AO number 2020-003, or the strategic framework on the adoption of integrated people-centered health services in all health facilities. Using the harmonized hospital client experience survey tool, feedbacks are taken from the patients or the companions who have received frontline services. So responses are encoded to the DOH Data Collect Hub, also known as the Health Facility Profiling System, which summarizes and transforms data into graphs and analysis, which can be found in the IPCHS dashboard. So for the regional distribution of submitted reports, the HFDB of DOH Central Office noted a total of 199,147 responses from the 511 hospitals with submission for the second semester. So as shown on the distribution graph of all the regions in the Philippines, there is an increase of submission by 275%, with submission from 136 to 511 since the previous semester's report summary. So this shows, or these findings indicate, that many health facilities have adopted the HS tool in assessing the responsiveness of their healthcare facilities and employees. And I'm so proud to say that the highest contribution, so in terms of the submission, is the Region 7. So consistent no for last year, the two straight every semesters of 2023, kita gyud ang nauna. So for last year, for the comparison lang, we have a total of 28 submission out of 110 facilities. But for the second semester, we already have 80 submissions. That is equivalent to 72%. So, and that makes an increase of 47%. Imagine, from 28 submission to 80 submission. So that is a remarkable accomplishment for Region 7. So congratulations to us. That is not possible no, without our health facilities who are very compliant to this program through adopting the HS tool as their customer feedback mechanism. And also for always supporting the programs of HFDU and to the Department of Health as a whole. For that, congratulations once again. So we hope that for this year, we will be able to have an increase pa na to atong submission, and making it 100%, no, from 80 facilities to 110 na gyud nga submission. So we hope that for those facilities no with no submission, ma-encourage unta nako karon that they may start to adopt and implement the HS tool in their respective facilities, no, to have a 100% complete and validated submission of reports for Region 7. So congratulations. Next, for the demographic profile, it shows that most of the respondents are female patients aged 20 to 34, and these are first-time visitors to the healthcare facility. The majority of them were Roman Catholics, with secondary education being the highest degree of attainment. So the point of entry for the majority was the outpatient department, and admission is the most availed frontline service. As to the breakdown of strategies, the IPCHS framework highlights the three strategies that are being measured. First, for the infrastructure and processes, the health facilities scored 91.4%, equivalent to outstanding. So, waiting areas has the best marks, followed by the streamlined transaction processes. However, in the graph, there is a need to improve more on the transaction turnover time, which means no, the amount of time taken to complete a process or fulfill a request of your clients. For client engagement and empowerment, receive an outstanding score of 92.5%. Again, equivalent to outstanding. So clients claim that the health facility staff was efficient in discussing issues connected to their problems and their needs were adequately met. For culture of responsiveness, scored 94.8%, which is considered outstanding. So this pertains to the rating given to the staff in the facility by their clients or their patients. Doctors and nurses received the highest rankings among the staff. So for the overall responsiveness, the strategies were deemed outstanding, no, gamering a score of 90.3%. So however, the report summary shows that there are still no many areas that may be improved or needs improvement. And for that, the conclusions and recommendations, the IPCHS emphasizes understanding and addressing the patient's preferences, their needs and values, which directly contributes to enhancing the quality of care provided in the health facilities. So the increase in submissions confirms health facilities' commitment to providing people-centered care and implementing effective quality improvement measures, which contribute to a more responsive healthcare system. With that, we have the recommendations now suggested that there should be an increased utilization of the HS tool in the healthcare facilities. They will promote the IPCHS to clients, health workers, and healthcare facilities. There should be an efficient encoding of responses to the DOH Data Collect Hub and encourage compliance and submission of health facilities. So similarly, the HS tool and the IPCHS module in the system are constantly being improved to be better measure and monitor the response of healthcare facilities. So that summary of the IPCHS responsiveness report for second semester for 2023 across all regions in the Philippines. And again, good job and congratulations to the Region 7 health facilities for that remarkable accomplishment. So just to reiterate, especially to those facilities who have not implemented or adopted the HS tool in their facility, that as per DM 2023-0244, health facilities are to utilize the DOH Data Collect Hub, which can be accessed through this website upon submission of your report. So all responses must be encoded directly to the system. Mao na siya karon ang atong mandato. So to those HS point person per facilities that have not yet joined the group chat, I encourage them to join na, as this will serve as our venue to communicate one another in terms of your queries, your concerns, your clarifications to the implementation of the HS tool. Also, we will be giving updates of the program and also to further extend our technical assistance as well. The group chat is our perfect venue to do that. So for other queries and concerns, not just for HS, but also for other HFDU programs, you may contact us through this number or via email address. So if you wish to have a one-on-one coaching or mentoring with one of the HFDU programs, you may request it and schedule a virtual meeting with us. So we would suggest to have it scheduled so that we can have kanang availability of time together, except lang sa mga holidays and other conflict of schedule. So that would be all for the IPCHS program, specifically for the hospital client experience survey. For your questions and clarifications, guys, you may type in on the chat box later on during our open forum. So thank you for all listening and have a nice day. And for that, moving on to our next presentation to discuss the updates on health facility profiling and medical certification on the cause of death. Help me welcome our very assertive, said, reliable, and dedicated nurse one of HFDU. We have Miss Jeremy Arangues. So a virtual applause, everyone.
Okay, good morning, Miss. Good morning again, everyone. And thank you, Miss Ho, for that very comprehensive updates on hospital client experience survey and for that introduction also. Again, my name is Jeremy Arangues, nurse one of Health Facility Development Section, and also the current program coordinator for Health Facility Profiling System, as well as medical certification and cause of death assessment in health facility, both of which na systems no are embedded in the DOH Data Collect Hub. But before I move on, I would like to acknowledge no kay we have um, additional participants who are with us. I would like to acknowledge the presence also of Dr. Alex Enriquez Aligrado of Allegiant Regional Care, as well as Dr. Debra Ann Custodio of Lapu-Lapu City Hospital. We also have with us Dr. Maria Lourdes Poblete Chan of Cebu Veles General Hospital, Police Major Josette Marie Oridina of PNP Station Hospital. Good morning. We have also with us Dr. Alvin Arinajo of San Lucas Medical, Dr. Almira Lin Ancajas, Chief of Hospital also of the Anbantayan District Hospital, Dr. Aideline Sison, Medical Director of ACE Dumaguete Doctors. And also we have Dr. Kazan Baluyot of Ramiro Community Hospital. So good morning once again. And then again, we also posted the attendance link on the chat box for you to register your attendance so we can acknowledge everyone properly. Okay, so moving forward, I'll be discussing updates on health facility profiling system and medical certification and cause of death assessment. Again, both of these systems are embedded in the DOH Data Collect Hub. So to refresh everyone, no? What is health facility profiling system? This is the annual data collection of information about inputs and selected quality indicators from all healthcare facilities such as hospital, infirmaries, and primary care facilities. That includes their basic profile as well as services, human resources, equipment, infrastructure, and others using an electronic platform, which is again the DOH Data Collect Hub. So for last year, no, an issue once, which is the Department Memorandum 2023-0244, was released for the implementation of the 2023 Health Facility Profiling System in all government and private hospitals, infirmaries, and primary care facilities in the Philippines, was released to provide guidance on the conduct of the annual profiling of all healthcare facilities in the Philippines. Additionally, to strengthen the implementation, the DOH CVCHD released a regional circular, which is the Regional Circular 2023-59, in which strengthened the implementation of 2023 Health Facility Profiling System in Region 7. So both issuances again provide guidance on the conduct of the annual health facility profiling in all healthcare facilities here in Region 7. So and in continuation of what was already accomplished of health facility profiling in the previous years. Again, through the DOH Data Collect Hub. So as you can see, this is how it looks like, no? Very familiar na to all facilities, no? Kay on board naman ang tanang facility as way back 2022 on the full implementation of health facility profiling system. So through DOH Data Collect Hub, we are able to gather data, and it becomes easier na ang data gathering. So because we are now using a paperless platform that is easily accessible and can be accomplished anytime. So for last year, the hospital, specifically the hospital and infirmaries, are tasked to accomplish the following modules, no, namely the facility profile, hospital tools module, which includes the patient safety, telemedicine, healthcare waste management modules. And another module is the hospital tools, which includes the nursing, pharmacy, IPC, PHU, and IPCHS tool or module, which was discussed a while ago by Ms. Cinco. And additionally, the health facilities are required to also accomplish the MCCOD module, which has a separate login details and deadline. But same lang pod na is utilizing the same platform, which is the DOH Data Collect Hub. So for the status of health facility profiling in Central Visayas in 2023, so in comparison lang, last 2022, only 91.07% of the health facilities in Region 7 were able to accomplish the health facility profiling. As of November 30 last year, profiling of hospitals and infirmaries in Region 7 already reached 100% accomplishment. So this will not be possible, no, without the dedication of the facilities, no, in profiling their facility, especially with our point persons, no, designated point person to do the health facility profiling system. So for this achievement, congratulations to everyone here, to all the facilities in Region 7 were able to accomplish the 100% accomplishment on the health facility profiling system. So we hope, no, na in this year we will still collaborate with each other, coordinate with each other in order for us to profile properly our facility. This is not again for compliance purposes, no, but to identify the gaps, no, in the delivery of the quality healthcare services to our community. So health facility profiling system activities in Central Visayas for 2024 includes an online orientation on the implementation of 2024 health facility profiling system. So this is targeted by July or August, within the time frame this year. And for the deadline of the accomplishment again for this year, that will be set again. Uh, Apology, no, for that typographical error, that is set on October 15, 2024. So moving forward, I will be giving you an update on the medical certification on cost of debt assessment in health facilities in Region 7. So again, like what I said a while ago, this system also utilizes the DOH Data Collect Hub and is also one of the modules that should be accomplished by the health facility. So to refresh everyone, MCCOD or medical certification of cost of debt assessment is the assessment of the quality of debt certification through checking for the presence of common errors in debt certificates and encoding the reports in the DOH Data Collect Hub. So an issuance also was released for the implementation, which is the Department Circular 2022-0293, the interim guidelines on the assessment of medical certification of cost of debt in health facilities in the whole Philippines. And to strengthen the implementation, the DOH CVCHD also released a regional circular on the submission of medical certification of cost of debt assessment in health facilities in the DOH Data Collect Hub. So assessment of debt certificates by the health facility shall be done on a monthly basis, and the submission of the monthly assessment report shall be through the DOH Data Collect Hub at hfpddc.doh.gov.ph. www.phil.gov.ph on or before the 15th month of the following month. So I would like to emphasize, no, for of the key players of MCCOD assessment, which includes a designated physician who is trained in that certification practices and understand the International Classification of Disease or ICD, that certification rules. Also, one of the key player is a trained hospital health information management staff who will prepare and endorse the death certificates to be assessed by the trained physician, as well as encode the monthly and annual data on the MCCOD assessment module on the DDC hub or the DOH data collect hub. So we would like to reiterate, no, since uh, a lot of rather last 2022 manggod na mga accomplishment or implementation was not really kanang na realize, no, kay una sa tanan wala na trained ang mga key players in accomplishing the MCCOD assessment in their health facility. So the DOH CBCHD also released this year regional circular, which is regional circular 2024-0016, in the reiteration of the enrollment to medical certification of cause of death MCCOD e-learning modules in the DOH Academy. So designated MCCOD personnel, the physician and the HIM staff are mandated to undergo the open access MCCOD e-learning modules in the DOH Academy, especially to those who have not yet undergone any face-to-face training. This will give them guidance on their roles and responsibility in the accomplishment of MCCOD assessment of the implementation in their facility. And we also highly encourage not only the designated no na mga personnel, but also the other HIM and other physicians in the facility to undergo this open access free module in the DOH Academy, because this will lessen errors ba sa atong medical certification of cause of death. So again, flashing on screen is the e-learning module uploaded in the DOH Academy for both physician and HIM staff. We also cascaded the links through the regional circular. So we have already sent those links through your official email address of your facility. So again, so like what I said a while ago, MCCOD assessment module utilizes the DOH data collect hub, same as the health facility profiling system. So I would like to emphasize on the submission of reports. No, for monthly submission, we have to accomplish both MCCOD DCA and MCCOD monthly tab. That should be accomplished on or before every 15th of the following month. So for example, no, na ay nag-ask, gina-ask yun ni every now and then, ma'am, what if walay debt sa among facility? Do we still have to accomplish the monthly submission? Yes, but only accomplish the MCCOD monthly, in which you have to indicate na zero ang debt sa inyong facility. And also part of the submission is an annual submission, which should be accomplished by the end of the year on or before 31st of December, which include MCCOD annual, MCCOD training, MCCOD policy, and MCCOD best practices tabs. So deadline of submission for again, no, I have to reiterate, for monthly submission it should always be on the 15th of the following month. So for example, for the debt certs assessed on January, the deadline of submission of those assessment of the reports should be on or before 15th of February. Okay, so for December submission, it should be on the on or before January 15th of the next year. Okay, may we request everyone to turn off your mic so that other participants may hear the discussion. Okay, for the annual submission, it should be on or before December 31st. So for monthly MCCOD assessment accomplishment in health facilities in Region 7, um, for 2022, no, sad to say, we only have 11 compliant facilities and 39 identified facilities with incomplete submission, and very alarming na 61 facilities no na non-compliant for 2022. But due to kanang well cascaded uh, training orientation on MCCOD assessment on in 2023, we already have 102 compliant na mga facilities and 8 identified facilities with incomplete submission. And congrats to Region 7. We already have 0 non-compliant na facility. So we are hoping no na mas ma-improve pa ni no this year. Now we are looking forward to 100% compliant health facilities in Region 7. So we would like to because we have consolidated Manda reports no in 2023 for the annual report, so we have identified the 8 facilities na unfortunately were unable to complete their submission during the deadline set January which was on January 15, 2024. So as of January 31, 2024, we have Kandihay Community Hospital and Maribuho Community Hospital, which are identified with incomplete submission. Most on under lacking DCAs for January to March for Kandihay, and for Maribuhok there was no submission noted for January to May and no submission on the training report. In Cebu province, Lapu-Lapu City Hospital, there was no submission for November and December last year, but I believe Dr. Masaren has already accomplished na no the mga lacking submission last year. So thank you, Doc Maseren, for extending or dedicating your time. No, I believe you have a lot of workload, but you spare time kay you are still identifying new HIM staff in your facility. For Our Lady of the Rule Maternity and General Hospital, there were noted lacking DCAs for January to March, May to July, September to December. And for Santa Rosa Community Hospital, there was no submission for monthly report for June and no submission for annual training policy and best practice for 2023. For Negros Oriental, Mabinay Medicare Community Hospital, there was a lacking DCA submission for November. For Nabilog Community Primary Hospital, lacking DCA for October and no submission for November and December, as well as no submission for training, policy, and best practice report. For Pakuan Community Primary Hospital, there was lacking DCA for August, and there was an incomplete submission for training report. So during the consolidation for the annual report, there were noted concerns, no, especially with the HIM staff, no, na maulagi to na the HIM staff who was designated to do the task were not renewed or wala na because of the status of their status of their job employment status. So some of them nawala na sa facility or no longer affiliated in the facility and were not able to completely accomplish no for the remaining parts of the year. So we highly encourage no na if kamakaya, we appoint regular employees to do the task so that there will be continuation of the submission. Or if not, kung magnihit lang gyud ta gyud sa atong kuan, we make sure na we capacitate our or endorse to our new HIM staff, designated staff, the the task properly, no? Especially the links on the online training para well guided ang ato mga HIM or the new staff na ni-replace in their roles and responsibility in MCCOD assessment. Okay, flashing on your screen also, because part of the validation that there is really a strong implementation of MCCOD assessment in our facility is that we have trained key players. So part of our validation for that is to ask for the copy of their training certificates, may it be a copy of their virtual or face-to-face training certificates that they have undergone MCCOD assessment training. So flash on your screen are those facility no na which lacks pa the submission of the copy of the training certificate. So we highly encourage these facilities no to please submit the copy of the certificates in our office through official email for the MCCOD assessment communication no the mccoda.hfdudoh7@gmail.com. So prior po kun sa atong monitoring, hospital monitoring, we would like you to accomplish this already, no? Para dili ta maglakay in the upcoming hospital monitoring and with the new iHome tool, which will be discussed later, MCCOD assessment or your implementation and your compliance to MCCOD assessment submission, we will be validating na one of the indicators mangod ang MCCOD assessment. So please, again, we are highly encouraging the facilities no, to comply with this submission. So for queries and assistance, you may coordinate with us through our local numbers 0322609740, local 441, or email us at our official email hfds@ro7.doh.gov.ph. And we also have an official group chat for the MCCOD designated personnel. So you may scan the QR code, flash on your screen, or refer to the link flash. But I believe 110 of the facilities in Region 7, representatives rather, of 110 facilities in Region 7 are already on board in the group chat. So we also provide technical assistance, no? Like one-on-one technical assistance or coaching every Monday, except holidays and with prior engagement, every 1 p.m. to 5 p.m. via Zoom meeting. So you may book with us for technical assistance through our official email. So if you have any questions, clarifications for health facility profiling system and MCCOD assessment, this will be a good opportunity na to scan the QR code, or you may input your questions or clarification, verification in the chat box. Okay, thank you. That will be all for the updates on health facility profiling system and MCCOD assessment. So to continue, no, on the program updates for HFDU programs, I would like to welcome on this virtual platform our IPC stalwart and a very assertive nurse also of Health Facility Development Section, Ms. Salome Antepuesto, to give us updates on IPC and nutrition and dietetics. A warm virtual applause, please. Thank you.
Okay, so good morning, everyone. But thank you for that bungog na introduction, Mami Mi. Thank you for gracing us today with your virtual presence. Hope all is well with you all. So to continue with the program updates, Regional Circular number 2024-0010, or the Submission of Infection Prevention and Control Plan for the year 2024 was issued. The IPC plan will aid us. Am I loud and clear?
Yes, ma'am. Loud and clear.
Okay, so again, the IPC plan will aid us in attaining action-oriented goals towards better health outcomes and stronger health systems. Among the 3 programs that we have monitored last year, The result of our baseline assessment for IPC implementation, it is poorly implemented. Most, not all, but most health facilities. This regional circular was already cascaded to all health facilities. Now, the deadline was set supposedly last January 2022, 2024, and was moved to February 16, 2024. But still, not all have submitted their facilities IPC plan. The IPC plan, as discussed last teleconference, should contain of laid out activities for the implementation of the infection prevention and control program that will address the findings of deficiencies for last year's monitoring and validation. As you can see in the template that I have flashed on your screens, there is an organizational structure. The organizational structure should be updated with representation from different sections of the hospital. Because as we have said before, that each section, each department in the health facilities have different concerns of IPC. The activities, again, should address the findings during the monitoring and validation. And it is highly suggested to conduct education and monitoring on basic IPC policies and procedures. This will monitoring on the compliance of healthcare workers in our facilities on IPC program implementation. Next, the following health facilities have pending submission of IPC plan. If you already have your plans with you, kindly forward it to HFDS at ro7. Yes, ro7.duh.gov.ph. For Bohol Province, Kong Natalio P. Castillo Senior Memorial Hospital has already submitted. Sorry about that. Only Tagbilaran Community Hospital is pending for Bohol. For Negros, Mabinay and Mabinay Medicare Community Hospital and ACE Dumaguete doctors have already submitted their IPC plan. For Cebu Province, we have at Mangranilla and Alan Adlawan, Camotes Medical, Bacalso Medical, Mandawi City Hospital, Santa Rosa, Camp Lapu-Lapu, and Lapu-Lapu City Hospital is yet to submit their infection prevention and control plan. To the following health facilities, if I have communicated privately or through email, please do forward your IPC plan, updated and revised plan, duly signed by your chief of hospitals or your medical directors. So that is it for IPC. Then let's move on to nutrition and dietetics update. For nutrition and dietetics, Administrative Order number 2019-003 was issued last 2019. This is the guidelines for the implementation of nutrition care process in hospitals. Na-help lang ato ang pag-roll out ani na administrative order due to the pandemic. Republic Act number 10862, or the Nutrition and Dietetics Law of 2016, was enacted to regulate and standardize the practice of nutrition and dietetics in the Philippines, with a provision on medical nutrition therapy through the application of nutrition care process for purposes of disease prevention, treatment, and management. Thus, in line with this, in line with the Nutrition Council's mandate of formulation an integrated national program on nutrition and relative to Universal Healthcare Act, and to capacitate a cadre of nutritionist dietitians in the implementation of nutrition care process, an in-depth training will be conducted on around June 2024. However, these are for level 2 and level 3 health facilities only. As of now, to prepare, kindly identify nutritionist dietitians in your health facility to participate in the said training. Official communication will be sent out soon to your official email address. So that is it for me. Before I hand you over to Ms. Arangas, our ever dynamic nurse one and moderator for today, let me say thank you for your hard work and dedication. You make a difference and your work matters. And for any questions, you make it in the chat box or during the open forum. or Skype through the query. Thank you and God bless.
Okay, thank you, Ms. Antipasto, for that incisive updates on IPC and nutrition care process. Moving forward to discuss on the green viability assessment updates, may we welcome virtually our green and safe advocate and engineer 2 of HFDS, Engineer Lord Daniel Alindaho. Virtual applause, please.
Okay, thank you, Mommy Me, for that wonderful introduction. So, may I have a thumbs up for everyone? Clear akong tingog. Okay, so by the way, sa mga wala pa kailan ako, I'm Lord Daniel C. Alindaho, Engineer 2 of Health Facility Development Section, your program coordinator for healthcare waste management and green and safe health facility. And if you're familiar with water and sanitation for health facility improvement tool or WASHWIT, which is under sa water, sanitation and hygiene or WASH. So I would like to thank you all for giving us your small time for our first quarter teleconference year 2024. So the Department of Health shall as much as possible promote the greening of hospitals and health facilities, including the improvement of energy and water efficiency and conservation, sustainable cooling systems, and sustainable healthcare waste management in hospitals. By embracing green healthcare practices, we not only reduce our carbon footprint, but also create healing environments that contribute to the overall well-being of patients, staff, and the community at large. Secondly, effective healthcare waste management is essential for preventing environmental contaminations and public health risks. So healthcare waste facilities generate a significant amount of waste, much of which is hazardous and requires specialized handling and disposal. So improper management of healthcare waste can lead to pollution of water bodies, soil contamination, and spread of infectious diseases. So for this morning, I'll be giving updates on the submission of Green Viability Assessment Tool for selected government hospitals according to the Department Memorandum number 2024-0026. So these are the following health facilities. So now I would like to thank sa mga ni-submit sa ato ang GVA tool, namely Vicente Soto Memorial Medical Center, Eversley Child Sanitarium and General Hospital, Cebu South Medical Center. So kaning mga naka-green sa inyong screen is katong mga nakasubmit. So katong wala pa siya mo green ang font nga sa inyong screen is please submit na okay, since ang deadline ani is gahapon February 29, 2024. So kindly please submit the GVA tool sa following email, sa among official email. And also, Camp Lapu-Lapu Station Hospital, Toledo City General Hospital, Governor William B. Lee Villegas Memorial Hospital, and Siquijor Provincial Hospitals. So please submit your accomplished GVA tool to GSHFP at doh.gov.ph and CC to HFDS at ro7.doh.gov.ph. So to access the tool, you may type the bit.ly/GVA tool. So the central office national objectives for this year prioritizes selected government hospitals. Thus, for private hospitals in the region, you may forward your GVA tool on or before first week of September. So this will help us prepare in advance once the central office national objective widens. So pwede rin po mo submit for private hospitals. Okay, for our ways forward, expect monitoring and validation for healthcare waste management, validation of green viability assessment tool for selected government hospitals, and also would like to request all health facilities to submit their updated healthcare waste management plan. So atong due date will be on April 12, 2024. Then submit it to the our official email, which is hfds@ro7.doh.gov.ph. So okay, for questions and or queries, you may join to our group chat for program updates. So kindly scan the QR code. We have a group GC for Cebu and Cebu and Negros and for Bohol. So point person ra ang kuno ang mas mayo ipasulod ani nga GC para dili pod mapuno atong GC kadali kay namon limit ang ato ang messenger sa mga members diri. So okay, for questions and clarifications, please encode lang your kuan through this link provided sa inyong screen. Yes, kuan for private hospitals is on September 20, 2024. Ako ibalik. Okay. So that would be all for the kuan updates of the GVA and the healthcare waste management. So thank you. So I'll be handing you over to Ma'am Mimi.
Okay, thank you, Engineer Lord, for the succinct updates on green viability assessment. Moving on to the next presenter to discuss on the updates on public health unit, specialty checklist of hospital, as well as e-referral and telemedicine. Let us all welcome virtually in this platform a proponent for quality healthcare and nurse 3 of HFDS, Ms. Anne Ermac. A virtual applause, please.
So our dear participants, our medical center chiefs of the 6th Department of Health hospitals, our chiefs of hospitals coming from our LGU-owned, our medical directors of the private hospitals, and their respective representatives, good morning. Now, how's everyone? I know that you are confronted with lots of compliances requested by the Department of Health, to include our section, the Health Facility Development section. Now, when we had our monitoring, I can remember that there are a lot of employees coming from the different facilities who are expressing, Ma'am, daghan na jud kaayo mo gi-require considering the manpower sa among hospital. But this is in view of our Republic Act 11223, or otherwise known as the Universal Healthcare Law. Now, with the vision to make the Filipinos the healthiest in Asia by 2040. So dako kaayo no ang envision sa ato ang Philippine Republic that by 2040 dapat tanan tang Filipinos are healthiest, no? Healthiest in Asia. Now, because of this, the Department of Health leads the development into a productive, resilient, equitable, and people-centered health systems. So there are a lot of mechanisms being projected, lots of processes, and tools to realize the vision of the Universal Healthcare Law. Now, one of the tools conceived is for the implementation of the public health unit. So we have 3 issuances pertaining to this public health unit. Now for 2024, we are on the functional level. Now in 2023, we had the organization. That's why we keep on asking the hospital orders in the creation of the public health unit. Now, one of the issuances is the administrative order number 180 series of 2000. So here in the screen, we can see the structure of the public health unit. It is being under the chief of hospitals with the corresponding manpower and also the functions of our public health unit. Then another issuance was issued on 2018, the administrative order number 2018-0028, pertaining to the guidelines in strengthening the capacity of the public health unit. In here, it is being stressed that the scope in the implementation is only affecting our DOH hospitals and all level 3 hospitals, both the government and private hospitals. Now, the very purpose of this issuance is to strengthen the Sentinel surveillance system for notifiable diseases, because this was the time nga moabutay or naa na gyud ang atoang COVID pandemic. Then another issuance was released in 2020. the Administrative Order number 2020-0019 pertaining to the guidelines on the service delivery design of healthcare provider network. In here, it was being stressed that the PHU shall be implemented by all Department of Health hospitals and our public and private health facilities. So, tanan na jud nga mga public and private health facilities are to implement our public health unit. Now, pertaining to the functions of the PHU, so it was being explained again and again that the PHU is concerned on the implementation of policies. Now, such policies must be aligned with our national public health programs. Now, talking of our national public health programs, so this pertains to our monthly health event celebration. So we need to promote, health educate our public, specifically our patients, concerning diseases. Then also, part of it is the surveillance and emergencies and disaster response. Then another function is to assist the hospital management in ensuring surveillance and reporting of notifiable diseases. Now, the notifiable diseases is being reflected in our Republic Act, number 11332, meaning this is now a law that there is a need to mandatorily report notifiable diseases and health events of public health. The number 3 is to ensure proper referral and navigation of patients. Now, talking of referral and navigation of patients, we have to lead our patients, helping them to ease their problems while staying in the hospital. So it can be referred within the hospital services, pertaining to the services, and also from the hospital to primary care facilities in the event of discharging our patients and other necessary facilities in the network. Now, for this year, we are on the functionality of the PHU. So we are now required to function or have our PHU function to their respective positions. Now, for the establishment, glad to know that our UHC integration sites already have established. They already have submitted their hospital orders to our office. So it is under the medical center chief, and the PHU must compose of the following. So for level 1, we only have 3 employees or designated employees to man our PHU. In level 2, we have 5 employees, and for level 3, we have 6 employees. So it is being flashed in the screen. Now, for public hospitals, we are going really to monitor the functionality of the PHU. Maybe later, mo follow ra gyud ang ato ang mga private hospitals. Then another is pertaining to the training. Now, in here, reflected on the screen is for the level 3 hospital. So they have to undergo the skills training on sentinel surveillance system for notifiable diseases. This will be conducted by our Epidemiology Bureau. Now, we have coordinated our central office because we want to have, or because we want to expand more on this training. But accordingly, the central office is now on the process of approving another issuance for the functionality of our PHU. So we have maybe another sets of trainings for this to make our PHU functional. Then another parameter is pertaining to the policies, the crafting of policies that the PHU has to do, the plans, and with the corresponding budget. So policies pertaining to the implementation of our health programs, policies on navigating our patient within the hospital, policies in navigating our patient up, no, referring our patient to higher facilities, and also discharging our patient to to the community. Then we also have we have to have corresponding budget, no, for our PHU to successfully operate. Then another is the reporting system. Now, the PHU has to submit an annual accomplishment report to the Office of the Medical Center Chief. So we will be checking on this also. Then also the PHU has to accomplish the data or the DOH data collect bed tracker application. Then the PHU has also to assist the hospital management in ensuring surveillance and reporting of notifiable diseases. And for level 3, you need to submit the hospital surveillance system e-report to the RESU. Then last is pertaining to the services, no? So the PHU has to maintain an updated database records, no? Or referral registry of all patients. So ang atuan ng PHU is in charge for the referral of patients in tandem with our OPD and our emergency, no? Or the ER. Then also the PHU has to manage the referral navigation. So I also have mentioned that earlier, no, from the hospital to primary care facilities in times nga ang atong patient will be discharged from the hospital. Then the PHU has to implement population-based health services, such as but not limited to health promotion, epidemiologic surveillance, health protection, and emergency preparedness and response. Another is pertaining to the specialty checklist. Now we have the level 3 hospitals being requested to submit their inputs to the link being provided. We have called up our level 3 hospitals for this. So the deadline for the submission was last February 16, 2024. And yesterday, we were being coordinated by the central office that there were 3 facilities or 3 level 3 hospitals who were not able to completely submit the requirements to the central office. So we already have coordinated our 3 level 3 hospitals. So you kindly do input your submission to the given link. Now for 2023, we have this list of our eligible APEX or end referral hospitals. We have the Governor Celestino Gallares Memorial Hospital, our Vicente Soto Memorial Medical Hospital, Cebu Doctors University Hospital, our Cebu Vélez General Hospital, Chonghua Hospital, Perpetual Succor Hospital of Cebu, Silliman University Medical Center Foundation, and University of Cebu Medical Center. Now moving on is on health referral system. Now we would like to stress the very objectives of our health referral, which is to make the referral processes effective. Now from the community down to referring our patient to the hospital facilities. Now the very purpose of this e-referral is to save lives of our patients. Now we are handling the patient's life, so we have to ensure the quality and continuity of care while referring our patient to the next higher facility. Then another objective is to foster a well-coordinated relationship among healthcare organizations in the health system. Then also we need to integrate referral management into existing clinical workflow. So you try to assess, no, whether or not ang inyong facility already have integrated, no, ang ato ang referral processes sa inyong existing clinical workflow in your respective facility para we can religiously comply, no, to the agreed upon protocols of the electronic referral. Now, there are types of referral. We have the urgent referral, this pertains to our emergency cases. So we have our Central Visayas Electronic Health Referral System wherein we are going to input the details of our patient, coordinate the appropriate facility in referring our patient for this emergency case. Then for the non-urgent, this pertains to our consultation of our patient. So we will be relaunching our telemedicine. Now, good for our highly urbanized cities because they already have started telemedicine, but we are going to announce to everyone that we have now our platform for the telemedicine, DOH owned platform. It is being attached to our Central Visayas Electronic Health Referral System. Now, we also have groups attending to health referral matters. So we have the Health Referral Technical Working Group. Now, this Health Referral Technical Working Group, they are the ones who constantly assess the functionality of electronic referral pertaining to the system's applications. No, for this, we have the IT people as member, then also the processes. So we have the OPD doctors, meaning our technical working group is composed of our IT people and our OPD doctors. Now, this technical working group will be the one to propose the improvements for the system application and the processes to make our e-referral functional. Then they have to submit their proposals to the Health Referral Committee. So mo ni atong second nga group, Health Referral Committee, with our Regional Director, Jaime Esbernadas, who will be our presiding officer for this, or our chairman of the Health Referral Committee. With the medical center chiefs, the AMHOP presidents per province, provincial health officers, city health officers for the highly urbanized cities, and some of the chosen employees of the Central Visayas Center for Health Development. So these are the members of our Health Referral Committee. Now for this year, to check on the functionality of our health referral system, the central office required the submission of the following. So we have the reports, We have the so-called local health systems maturity level, to check the progress, the compliances of our UHC integrated or integration sites. Now, for Central Visayas, we have 3 UHC integration sites, namely our Cebu Provincial Integration Site, our Mandawi City Highly Urbanized Integration Site, and Bohol Province, as our integration site. Now, for the reports, so we need to take the rate of coordinated referrals. Now, we have number 1, the PCPN or the Primary Care Provider Network to referral facility level, to referral facilities. Now, talking of Primary Care Provider Network, these are the facilities, our RHUs, our clinics, our birthing facilities, which they are also to make use of the system to refer their patient to the appropriate facility. So take note of the word appropriate facility because we have to base our referral also to the classification of cases. Naaman tayo mga classification of cases, approved, sa ato ang Central Visayas Center for Health Development. And I guess it is being cascaded to all health facilities. So you have to refer the cases on the classification of cases, where to refer your patient. Then another is the referral facilities to other referral facilities. So pwede mo refer from level 1 facility we can also refer to another level 1, no? Daghan tang mga reasons for referral, or level 1 facility to level 2, or level 1 facility direct to our apex, no? Then letter B is the leading cause of referrals. Unsa may mga examples of kanang leading causes of referrals. One is kung gi-admit ang patient not within their service capability. So, for example, wala day OR ning infirmary, so they have to refer it to level 1, no? Mo follow yun ta sa healthcare provider network. Then another is the lack of manpower. So, level 1, no, in the absence of the or inavailability of our anesthesiologist. So how can we perform surgery kung wala tayo anesthesiologist? So we have to refer it. Pwede na itong i-refer to another level 1 nga maka-function or makahatag sa maunga service. No, or lack of equipment. For example, kanang ato ang functional x-ray or our functional ultrasound. Then another is the declined referrals. So we need to take the percentage of referral that were declined. Unsa may mga top reasons for declined referrals, we also have to jot down, no? And letter D is the patient satisfaction rating on service delivery. Now, in letter D, we still have to conceive on the parameters, no? In assessing the rating satisfaction on our healthcare or our health referral system. Now, for the urgent, non-urgent referral, we have telemedicine. So again, we are glad to inform everyone that we have now the system application ready for launching. So it is again attached to our e-referral application. Then for the status, we need to relaunch and cascade the processes being reflected in our DOH DILJ PhilHealth Joint Administrative Order number 2021-0001. So our telemedicine will also follow the flow of our referral system, no? The patient flow in the network. Okay, for questions and clarifications pertaining to what has been discussed, you may check the link. No, please encode your questions through the link and QR code below, no, or reflected in the screen. So that could be all. But before giving back to our beautiful moderator, Ms. Jeremy Arangues, allow me to share a quote pertaining to service. It says here, service is what life is all about. Great acts are made up of small deeds. Goodness is the only investment that never fails. As we serve others, we are working on ourselves. Every act, every word, every gesture of genuine compassion naturally nourishes our own hearts as well. Again, a pleasant morning to everyone. Back to you, Miss Mimi.
Thank you, Ms. Anne Ermac, for that continuous update on PHUs and specialty checklist, as well as on e-referral and telemedicine, and for that very encouraging quote, no? And for the most awaited topic for this teleconference, we would like to welcome on board also in this virtual platform to present the introduction of the new iHome tool. Let us all welcome virtually a champion for public health and governance and the Nurse 5 of Non-Communicable Disease Section, Mr. Ryer Jude Pipito. A virtual applause, please.
All right. Thank you, Miss Jera, for that wonderful introduction. I'd like to check before I start my discussion. Is my audio loud and clear?
Yes, Sir Rai, your audio is loud and clear.
All right. So Thank you very much, no, for attending. As I was observing the meeting room, it reaches to 100 plus of participants. So we started this teleconference just for 50 participants, then it boils down to 80 and then 90. Now I can see your enthusiasm and your participation in this endeavor, no, in implementing the different programs of the Department of Health, specifically of the Health Facility Development section. So today, I will be giving to you the updates or the new tool of the iHome tool, which as presented in your screen, you can access the new iHome Sat through the link or through bit.ly/3RUAGJR for you to have a copy of the said self-assessment tool for iHome. I believe you are all familiar with the iHome tool because we have conducted all the we have visited already all the facilities in Region 7, and we are happy because we have reached our target to visit all the facilities so that we can really see the picture of what's going on the health of our respective health facilities, not just on the private sector but also to all public and private facilities in the Region 7. So no, I'm very proud of all the facilities, no, because based on the presented accomplishments, we garnered a top uh, a place, no, in accomplishing all the reports that is needed by the central office. I understand, no, na overwhelmed na itong mga facilities because nakatay kulang og manpower, no, and then the deadlines are always overlapping and at the same time. But at the end of the day, it's a matter of how we manage our time and how we implement and strategize our interventions in relation to the implementation of the different programs of the health facility development section. So next slide, please. Just a recap, what is iHome? So when we say iHome, that is an integrated hospital operations and management program, which is anchored to continuous quality improvement. No, I believe that iHome ensures that the implementation of the standards and guidelines aim to improve the efficiency and effectiveness of our services through the creation of an information or clinical and administrative and monitoring purposes in hospitals and other health facilities. I am very happy that looking on the data that we have presented a while ago, presented by the speakers a while ago, no, we can see a different story if we have a data that is complete and at the same time a comprehensive data, because that will be the basis as a program for policy development and intervention to further improve our operations management in our respective facilities. However, I understand na kalain-lain gyud tag pamaagi sa ato ang facilities, but we have to set standards for us to have a unified hospital operations and management system. Next slide. So basically, this is the strategic framework of iHome, which has the vision, the mission, and the goals. Wherein the vision is to have a quality, safe, and people-centered and efficient hospital operations in the Philippines by 2030, and to ensure that the effective and efficient hospital operation through the implementation of standards and supported by a continual innovative system and technology improvement. And at the same time, the ultimate goal of our iHome is to enhance the preventive and the promotive role of hospitals, both in the government and private facilities, through the improvement of our management system and procedures within the hospitals. Kanina, no, I was happy because it was mentioned by Dr. Laurel, no, our very supportive section head of the HFDS, no, basig, there is a difference between our lead and our unit, or which is the HFDU. I believe you understand now why we are here and why we conduct monitoring also. So next slide. So basically, the objective of this iHome updated tool is to implement the standards and policies for the hospital operations management and to standardize the systems and procedures of hospital operations, including the flow of information. Because if you have the right information, it will lead you to a right intervention or a concrete solution to the challenging circumstances that may come within the entire operation of our system. So, and also to fully utilize the hospital data, information for evidence-based decision making, and for clinical management of patients and policy and standard development. If you could observe that we are always looking on your policies, the different policies in the different policies of your hospitals or facilities, no, that may help you in standardizing our procedures and operations in the hospital. So next slide. So the objective of this framework is to enhance and expand the hospital information system. Now you have gathered the necessary information based on the health facility profiling system, such but not limited only to iHOMIS, HOMIS billing system, universal healthcare information system, and etc. Which is our objective is to address the growing needs, no, and the clamor and the linkages with other health facilities and information system developed by the other NGAs. Next slide, please. Okay, so under the Department Memorandum 2023-0222, wherein there is a guidelines on the updated iHome SAT and validators guide. So based on the DM, that all hospitals shall conduct a periodic assessment of its compliance to the standards and functionality of the hospital operations. Next slide. So it was amended to cover the updates of the Health Facility Development Bureau of the Manual of Standards and other policies and plans of the department. So don't worry, we will provide you a copy of the manuals, no, of the 21 manuals to be disseminated in your respective facilities. So we will send an e-copy for you to be guided on the different standards and the manuals of the standards of the iHome and the different manuals of the HFDB. So it is also intended to identify the gaps and challenges encountered at the operational level. Kung maka-observe mo, if you could observe that we are always collecting data because this is our point of analysis, meaning to say we are looking into each facilities wherein unsa may kulang ani nga facilities. What are the ways how to improve their operation in terms of this particular facility? For instance, we're looking into the data to all level 3 hospitals, level 2 hospitals, level 1 hospitals, and our infirmaries, and including later on, our primary care facilities. Wherein this data that has been generated and has been gathered will be used for further improvement of our systems and processes within the hospital operations system. All right, so again, to access the iHome tool, we have bit.ly/3RU-AGJR. But don't worry, I'll be giving my slides to all the facilities for you to be guided on the things that you need to comply and to have a better understanding on the different manuals to be cascaded in your facility. So you may download the file and accomplish it offline because since this is a self-assessment tool. All right, next slide. So basically, what is the new iHome tool? So it has been a clamor nga, sir, during our monitoring, sir, taas kaayo inyong tool, no? Daghan kaayo o gipangayo because we are talking here about the entire operations of the hospitals. Kung kabantay mo during our monitoring, we encourage all the section heads and the different supervisors in the areas to come with us during the audit because we want to know if we want to check also if this is if your policy has been implemented and cascaded to your staff or to the hospitals, or how was it implemented in their respective areas of designation. So also this tool was also amended or revised because we have to remove the redundancies with the licensing assessment tool para dili na mo maglibog no nga gipangayo man sa licensing and then kamo pud nangayo sad mo ani. So basically, just to remove the redundancies and to remove our confusions, so that is why we come up with a simplified tool of the self-assessment tool. And it is also incorporated with new policies and standards based on the manuals and the copy of the manuals that we'll be giving to you later on. So basically, that is the picture or that is the image of the iHome tool or the self-assessment tool. for hospitals. Next slide. All right. So basically, it is also one of the strategies to use to measure the compliance of hospitals to the DOH standards. If you could notice, we have we are very proud that we were able to conduct the first ever hospital summit and awarding ceremony last. I think that was in November, if I could remember it right. No, by that, dili lang yun to ingon na nag-award me, it's because mauni siya ang mga facilities nga among na-visit. But we base it on evidences and your scores based on the iHome tool. No? If for the information of everybody, we have sleepless nights to do that because we need to analyze who are those facilities who have exemplary performance in terms of compliance to the tool and at the same time for the implementation of the iHome self-assessment tool. So the purpose is to identify our gaps and problems encountered in the implementation of the program and the HFDB Manual of Standards, because it's totally different if we conduct it virtually. No, I cannot personally. I don't want a virtual validation because I cannot see what's really going on or unsay problema dito sa atong facility. No. By the way, when we conduct monitoring visits, it's not about fault finding, but rather we are there to help you because our mandate of our bureau is to help you and to provide you with the necessary technical assistance for further improvement of our facility and for continuous quality improvement of our facility. So that is why malipay gyud mi kung naagi mo book na mo every Monday. That's every Monday we provide technical assistance between 1 p.m. to 5 p.m. because among nakita no nga if the hospital or the facility will book with us, so meaning to say you are very much willing no for further improvement of your facility. Again, dili mi stricto, but rather we are there to help you. What are those non-conformities that your facility has been among na identify? Because at the end of the day, it boils down to providing quality and accessible care to our patients. And at the same time, we are there to improve our facility, our services for the people, and above all, to our community and to our clients. Okay, so basically, I'll just orient to you the different indicators of the iHome tool. Since this is very new, karon sayo na ni siya because it has a standard criteria, it has an assessment guide, and sa una, we use the scoring system. Nagya po tayo scoring system karon, but it's a yes or no answer. So when we ask this kind of assessment guide, like for example, do you have a policy of infection prevention and control? If you have a copy of that policy, then automatically you will be graded as yes. If we don't have any policy nga among makita, then definitely we will answer it by no. And then we will provide the necessary remarks for the non-conformities identified during the audit or the monitoring. Next slide, please. So the iHome self-assessment tool was developed because this is the result from the validation activities that shall be used as a basis for policy development. Kung i-mention ganina, no? For planning and identification of the necessary technical assistance needed by the hospital, such as but not limited to allocation of resources, funding support, and to conduct of learning and development interventions. So that is why dili gyud ni namo walaon ang ato ang teleconference, because this is one way of another to communicate to you and to update you quarterly of what's going on. It's not because nga pag ana lang namo sa monitoring mao lang gyud ni atong buhaton, no? But we are constantly communicating with you because we want to help you. Again, we are there to help you because we are mandated by the office, by the central office, and by the DOH to help you improve our continuous quality improvement of our hospital operations. Next slide. Okay, so the scope and coverage of the new iHome tool is applicable to all government hospitals and may be used as reference in the assessment of private hospitals and infirmaries. No, so basically this is the scope and the coverage of our iHomeSat. Next slide. So the tool should be accomplished in a holistic manner by coordinating and collaborating with the different services, departments, sections, and units of the hospital. So that is why during audit, patawag yun na mo tanan ang mga section heads because dili raman sad makaya ni chief of hospital nga siya ra gyud mo answer sa tanan because we have a lot of validators and assessors to conduct the validation. Again, let me erase that fear no nga mayon mo na mahadlok gid mig taga DOH kay mag-validate or mag-monitor no. We are there to help you. Again, if unsay policy nga na-craft ninyo, we will teach you. We will provide the necessary assistance or technical assistance and inputs no na pwede na to nga maka-help ninyo to improve your facility operations. Next slide. So each item is answerable by a yes or no and should be supported by an explanatory text or evidence if possible, such as but not limited to institutional manual, hospital statistical report for the last 3 to 5 years, and other reports. For some items, actual data is required to be provided because we want an actual data because like for example, the incidence of or the data on turnaround time, no, the number of cases, the number of falls per month, the number of HEA or high no of the hospital, and then the falls, and those important data that is relevant to the hospital operations. Next slide. So basically, the prescribed process of iHomeSat validation is you will conduct first your self-assessment, meaning you have the copy now, so you conduct the self-assessment. So the iHomeSat will be accomplished by the health facility annually. And the next step is the validation and the action planning. When we were in, here comes the validation, the analysis of the data being gathered, and your action planning, meaning what are the things that you have planned in order to accomplish those non-conformities or non-compliances that you have been identified during your self-assessment. And also, we will be conducting the implementation and the monitoring, wherein the commitment at the facility level to implement the action plan. Since you have the plan already, ato na siyang himuon into an action plan. Then after that, after the implementation and monitoring, you gather data for report generation. These are annual report and submitted to the HFDU to our bureau, which is the Health Facility Development Bureau. And at the same time, it does not end there, no, on the report generation. So it is a cycle. So after the report generation, you do again self-assessment. What are those policies that are lacking in our facility? What are those processes that needs improvement? What are those policies that needs revisions? So you validate things and you make an action plan. Once your action plan is done, you implement the plan, meaning by implementing, and you do conduct monitoring. You don't have a problem with monitoring because the manuals has also a monitoring tool or a self-assessment tool. That would be your guide in the implementation of the different programs of the iHome or the programs of HFDU. And by that, you report the generation for report generation and data analysis and interpretation. So next slide. So basically, these are the information that we need on the iHomeStat. Your respondents information, no? The name, the position, the designation, the mobile number, the email address, no? And the hospital profile also. The name of the hospital, address, the authorized bed capacity based on law and based on licensing. And then the classification according to ownership. Is it government or a private? Then the scope of services. What are those services? No, it could be a general or a specialty hospital. And the functional capacity. Is it level 1? Are you level 1, level 2, or level 3? So next slide. So basically, this is the summary of scores per area or category. No, so it has a total of 100. It has 7 category. Like for example, the governance, the ethics and patients' rights, quality measurement and improvement, integrated people-centered health services, patient safety, facility safety and emergency management, and the resource management. Okay, so basically that totals 100% for the scores. And then you have the actual points and the interpretation of scores. It could be explanatory note or excellent, very satisfactory, satisfactory, fair, and poor. Next slide. So basically, let us start with governance. So what I am giving you in the presentation is for you to have an easy understanding of each sub-indicators per indicator. I have presented here the remarks. So meaning to say, you have a guide there. Like for example, if I ask for an institutional hospital policy manual, is it accessible and disseminated? So your assessment guide would be, you present and available and accessible in all areas. So as a validator or as a self-assessment or as a iHome point person, you check the areas for availability of hard or electronic copies of the manuals and policies in the respective areas in the hospital. So if naa, you may check yes or you may check no. Okay? So the second indicator is that does the hospital is compliant with the standard organizational structure based on the DOH standards and policies. So the hospital organizational structure is compliant with the latest revised organizational structure and staffing pattern for government hospitals. So by this, di na mo maglisod, no? Okay, I have placed here for level 1 and level 2 government hospitals, you refer to DBM, DOH Joint Circular number 2013-1. Now for level 3 government hospitals, I have stipulated here also or indicated that level 3, the government hospitals, that's DBM DOH Joint Circular number 2022-3. For you to have a guide on what is the staffing pattern required by each level of the hospital organizational structure. Okay, so next slide. So let's proceed to the third sub-indicator, that is the hospital's performance or quality indicators are posted for public information. So no, is it posted or displayed in a conspicuous places within the hospital premises? No. Enumerate the quality indicators posted. You should use a separate sheet if necessary. So by there we will be asking the actual data. So indicators, no, I have placed it here, no, that indicators may include but are not limited to customer satisfaction rate, occupancy rate, bed turnaround rate, and etc. This is for public information. Posted should be in a simplified and to ensure that it will be understood by the patients and the relatives. So dili pwede na ang imong band paper, ang imong font size nga gigamit for your data is font 12. So basically, dili gid na mabasa sa atong mga clients. So make it as much as possible readable and visible sa atong mga clients when they go to your facility. Fourth sub-indicator is the processes are regularly reviewed and updated, meaning the self-assessment tools of the different HFDB manuals or programs projects are regularly accomplished, no? So you refer to Annex A for the list of comprehensive assessment tools. So again, ako na po ni siyang gihimong guide diri, ako na siyang gibutangan, no? It can be accessed through bit.ly/DOH HFDB manuals. So when you click that link or when you type that link, there are a list of manuals that will be served as your guide. So kanang mga manuals, na siya ang healthcare waste, ang IPC, billing, dietitian, DSWD, social worker, no? All the in terms of operations in the hospitals, makita na siya dito sa atong manuals. And you may also refer to Annex A of the updated iHome SAT for the list of the HFDB manuals and programs. So also, there should be a mechanism in place on the manner and the frequency of the review being conducted. So we have to check for established processes like work instructions, no? Tanaw na to if naaba mo work instructions, naaba tayo standard operating procedures, or any similar documents that will support to the manner or the mechanism that is being asked during the audit. So next slide. So basically, this is Annex A. These are the list of HFDB manuals and programs with an individual self-assessment tool. So, di na gid mo maglisod ani no when you implement this in your hospital because naana mo'y manual to guide you, and at the same time I have listed here the annexes of the list of manuals. So for nursing service, you have the monitoring evaluation for nursing service. For hospital pharmacy, naapod tay assessment tool. For nutrition and dietetics, tay assessment tool. For manual for medical social worker, we have also a tool. For IPC, for quality management system, for clinical laboratory, we have also a tool for that for you to be guided. So next slide. Also, it will be and the rest of the self-assessment tool. Overall, it has 15 self-assessment tools that will be used for your guide to the implementation of these standards and procedures. So it could be accessible again at bit.ly/DOHHFDB manuals. So you may type in or you may click this for your reference. Next slide. So basically, another indicator, there is an integrated health information system in place that is compliant to the Manual of Standards of System. No? So, ana ni mo makita ang hospital implementing ba ang IHIS or compliance with Section 36 of Republic Act 11223 or the Universal Healthcare Act. So, meaning transition plan from manual to electronic implementation of the hospital processes and a random observation of the actual implementation. Is the IHIS implemented has been validated by DOH? Yes or no? So check the results of the HIM SAT or if it's SCIV validation and documentation. So identify areas with functional IHIS or those who have transitioned to a computerized system. So use a separate sheet if necessary. Okay. And number 6, the decisions of the management are evidence-based, meaning to say there is a presence of your hospital development plan and other similar documents are based on the real-time data and program management direction. So you check if your plan is aligned with the strategic direction and interventions, priority targets, and other relevant considerations. Next slide. So there is an oversight contracts or other legal documents, no? So these are the contracts and other legal documents are reviewed and monitored for any implications for its implementation. So I have indicated there that policy on the process and person responsible for the oversight and the review of legal implication before, during, and after the implementation of the contracts and other legal documents as well as its monitoring. So, kanina gi-mention po din no, is there a functional public health unit? So, you are guided now on the things, what are those requirements and the composition of the PHU. So, appeal na ni siya sa indicators, I hope, no, that the PHU is established under the office of the medical center chief through an issuance of a hospital order. So, you check for the hospital order if there is this point person and the functions of the PHU and the composition of the PHU. So PHU in the hospital, percentage of functional of the PHU that is scored based on the PHU hospital tool in the health facility profiling system. There is an actual data that is needed in this part. So for 2023 onwards, the percentage of the functionality scores will be incorporated in the PHU module of the health facility profiling system. Next slide. So another indicator is the number 2 indicator is the ethics and patients' rights. So the standard criteria is that first is there are policies covering patients' rights, beliefs, and culture. So we will check on the institutional policy or hospital policy manual, which includes these following provisions: anti-deposit law, anti-detention law, the Muslim burial, indigenous people, and all related policies indicated in the tool. So if there are other hospitals issuances covering specific sectors, you may specify and use a separate sheet if necessary. So document review of the aforementioned policies and issuances. That is why if I'm going to have an audit, I have to read all your policies and guidelines for me to check if that policy or that specific guidelines is being implemented and disseminated in the respective areas in the hospital. So next slide. The hospital conducts a staff orientation of the patient's rights, meaning to say The hospital conducts a staff orientation on the patient's rights, meaning the staff in your hospital oriented on the patient's rights is listed in the annual learning and development plan of the hospital. And you have to provide copies of the attendance sheet and certificates. That is the proof that you have conducted a staff orientation. So again, we will conduct a document review. And then the hospital analyzes the trend of the NBB satisfaction rating, meaning the hospital analyzes the trend of NBB, so no comment satisfaction rating of the hospital in the last 3 to 5 years. So you compare the no balance billing or the no comment satisfaction rating of the hospital in the last 3 years and explore the possible reasons for the improvement or worsening of the said rating. Next slide. So the hospital conducts regular patient education. No, I believe that patient education is also incorporated in case management protocol. No, we have to check if it is signed or approved case management protocol if patient education is incorporated therein. So there is also available and accessible information like your IEC materials in the hospitals, like you provide sample IEC materials and proof of dissemination. So we have to look into the IEC materials with the hospital premises. So if you want to ask for IEC materials, we can help you. We have to tap our Health Education Promotion Office. They will be providing e-copies of the said education information and education communication materials. And then moving forward to provide a list of units, department, and services of programs in the hospital that conducts patient education. No, you may use a separate sheet if necessary. So again, document review, no, sample attendance sheets, CSS, and activity reports of the said activity. Next slide. So fifth, the patient health record or the patient's chart, which reflects a multidisciplinary approach in patient care management. So meaning that these are the patient health record completed upon its submission to the Health Information Management Department. So meaning when we conduct an audit, we have to conduct we have to have a random sampling of patients' charts and check for completeness and the data information. Right? Next slide. For number 6, no, the accessibility and equity in the provision of a specialized care is practiced. Now you may ask, what is this specialized care is practiced? So when we say, I have indicated here at the bottom part that specialized care is operationally defined in this context as the care needing the services of doctors who underwent special training. Examples would include those who have undergone training for orthopedic surgeries and cardiovascular surgeries. So basically, we will be asking also the turnaround time of scheduling of surgery and indigent patients and waiting time of indigent patients in the scheduling of their specialized surgeries, and the ratio to pay to indigent patients specifically for specialized care. So actual validation of the eligibility process done, and then the computation for this ratio is the total number of indigent patients divided by total number of specialized care and then times 100 to have the actual data. All right, so let us proceed. Next slide. So let us proceed to the third indicator. We are 3 out of 7 already. So for quality measurement and improvement, the hospital is ISO certified and performance governance system PGS compliant. So PGS is applicable. No, PGS certification is only applicable. I have indicated that at the right part. No, that PGS certification is only applicable to DOH hospitals, while ISO accreditation is monitored for all government and private hospitals. So, so that is why I am happy to use the iHope tool because this is compliant also with the ISO standards. So if your hospital is practicing or is adapting the iHome tool, so there's no need for you to maglisod understand on the ISO accreditation because what we are following is tailored fit with the ISO accreditation. No, so indicate the stage of the hospital in the PGS certification. Next slide. So Number two, there is a system of monitoring and analyzing the performance indicators of the hospital, meaning there is a documented information explaining the process, mechanism, or system of monitoring and analyzing performance indicators of the hospital. So, pwede analysis reports, monitoring matrices, or similar documents submitted and presented to the management committee for the utilization in the evidence-based decision making. And the third, there is a hospital analysis on the efficiency indicators in the last 3 to 5 years, meaning the hospital collects and analyzes efficiency indicators such as, but not limited to, the average length of stay, bed occupancy rate, the operating theater utilization rate, the ambulatory surgical services, the budget utilization rate, the days cash on hand, collection efficiency, inventory days on hand, payables index, liquidity ratio, activity ratio, and operational ratios. So they are included or reflected in the official reports in the integrated and updated our latest hospital development. So again, you have to analyze the report, you monitor the matrices, and similar documents submitted and presented to the management committee for the utilization of their evidence-based decision making. All right, so next slide. Fourth is there is an active iHome committee. So basically, you have to have an hospital order, no, to have a iHome committee for them to for your hospital to have a committee, because we have to make sure the implementation of the iHome tool in your facility. Okay, so number 5, there is an established integrated hospital management section, or iHomies, or integrated management information system section. So meaning the hospital has a functional iHomies, or iHomes, with a dedicated physical space and staff, and this section included in the updated organizational chart of the hospital, which is only applicable to level 3 hospital. So inclusion of the section is the organizational chart of the hospital and in any planning document for allocation of resources, and the resources may include office needs, staff, and the human resource, and etc. Next slide. So there is an active CQI. Again, iHome is tailored or anchored to our continuous quality improvement. So there is a functional CQI committee in the hospital, no? Document review ra gihapon. That's number 7, the unplanned readmission rate of the hospital. So for the computation of that, using a 30 days since discharge, count the number of readmission divided by the total number of discharge, which is the lower and the sum the better for the hospital. Okay, and then for the medical death certificates are assessed regularly. The hospital complies with the monthly submission. No, we discussed ni Ma'am Mimi ganina. No, that MCCOD is also included. So we have to check the compliance with the MCCOD module in the DOH DDC Hub. Next slide. So 9 is there is an active pharmacy and therapeutics committee. Is there a functional prime pharmacy and therapeutics committee in your facility? So there is a document review and updated hospital formulary and other supporting documents. Number 10, the availability of drugs and medicines is monitored. So meaning there are availability of drugs and medicines are monitored. The percentage of unfilled prescription, no, we need the actual data. So when you say computation, that is the total number of prescription and minus the filled prescription, and then divided by the total number of prescriptions times 100. So I know the pharmacy department is very familiar with this in terms of the computation of the said data. So there is an analysis on the reason for bid failure. No, provide a procurement or bidding results, and document review ra gihapon, and the analysis of reports, and the list of the aforementioned drugs. Next slide. So let us proceed now to the 4th indicator. This is the integrated people-centered health services. So there should be a feedback mechanism using the client experience survey tool is being utilized to assess the responsiveness of the facility to the needs of the client. So ganina, it was discussed by Ms. Hope about the responsive report which is to be generated from the consolidated CAS tool responses biannually to assess the overall satisfaction and the client experience in the facility. So ang report will be utilized to improve the service delivery of the health facility, and the latest responsiveness report must reflect the rating from the previous semester. Okay, so again, I've seen here that can we ask for a copy of the iHomes? Yes, ma'am. We will provide you a copy of this slides for your guidance and for you to have an easy access of this tool. All right, next slide. We also have the second sub indicator. There are available or accessible wheelchairs and stretchers at the designated area. This is usually found on emergency department and outpatient department for PWDs, elderly and senior citizens. So there is an actual validation of this part. And then the physical location of the units, departments, services promotes utmost convenience and safety to the patient. So meaning that is for benchmarking of the traffic or patient flow of the hospital is compliant to the hospital design standards and modifications are justified. No, that is an actual validation. And then clustering of areas in according to working relationship, infection control, or patient safety. There is no redundancy in the activities and locations clustering are convenient for patient transactions. No? And then the hospital is compliant to the standards for basis for and then you check if the hospital abides with the DOH Administrative Order 2021-0015. All right, next slide. So we are now on an indicator 5, which is patient safety. So basically, you follow on the WHO's the 6 patient safety goals. No, so the department conducts clinical audits. No, are the documents reports on the regular conduct of clinical audits. So we will be looking into their audit reports, like patient case reviews, such as mortality and morbidity reporting, checklists, and etc. And number 2, there is a system of monitoring and reporting of sentinel events or medical errors. No, so these are available hospital policies and reports on the following: pharmacovigilance, no, nursing quality documentation, food and safety provision, the nutrition care process, laboratory process, and others. So basically, we will conduct a document review of this. Next slide. So the hospital is compliant to the infection prevention and control standards and policies. No, mora ba gyud ni kasagaran namong findings, no, in terms of the infection prevention and control. No, so there is a functional IPC committee. We have no problem with this because majority of the hospitals in Region 7 have a committee. However, there are certain or maihap lang ang facilities nga needs revisions of the committee. And then the hospital have policies on IPC such as but not limited to sanitation, hand washing, and isolation, etc. No other hospitals, no, like bigger hospitals, we have seen a good implementation of infection prevention and control. So we are so impressed with the policy, the implementation, and all those things nga among nakita during validation. So don't worry for those hospitals nga need pag-revisions of their policies. Again, we are here to help you and to provide the necessary technical assistance, and you have the manual also for you to be guided. And there is a system of monitoring for the compliance of IPC standards, policy, and guidelines. So medyo akong nakita ani na problem is that due to the lack of staff, no, ang IPC overwhelmed na atong mga chief nurse, atong mga nurse supervisors nga they will have a 3 to 4 functions in that particular facility. So the IPC murag na left behind, which is when we say IPC, this is everybody's concern. No, okay. IPC should be strictly implemented in the hospital. No, for us not to acquire the HAI or the hospital acquired or healthcare associated infections. All right, and then the validation is through the IPCAT, which can be found in the Manual of Standards for IPC. Next slide. Now, indicator 6. For facility safety and emergency management, these are the standards or criteria. Okay, so the hospital plan and design considered safety measures and protocols based on the existing standards. So there is an approved, signed, and master site development plan. No, it can use the HSI or the STAR tool of HMMB for more comprehensive assessment. And permits have been secured by the hospital, like the fire permit, the structural result, the certificate of occupancy, and the like. And then the second is there is a plan or policy to implement healthcare waste management. So nianhin na ni tamin na pud si healthcare waste management, no? Which is amo pong nakita na majority of the hospitals are they lack on the policies on the implementation of our healthcare waste management, no? It's a sad reality nga amo nakita na problema gyud pud ta sa ato ang third party, no? Na who will collect our healthcare waste. And again, as much as possible, no, during our monitoring, please do not burn your healthcare waste management because you will be penalized by the DNR if ever you will be caught. No, so mao gyud na among hangyo. As much as possible, if the hospital cannot afford yet, as long as our healthcare waste is being properly stored, properly locked, properly segregated, and wala tay problema about ana. No? So again, hangyo lang sa mga facilities na we don't want you to be penalized, but we are here to help you on how to manage our waste and use the manual for us to be guided on the things that we are ought to do, no, for the implementation of our healthcare waste management. Next slide. Okay, there is a facility map available and signage for easy navigation of our clients. No, these are facility maps posted and available in the hospitals. These maps should include hazard maps, evacuation maps, and others. So HFDU now will capture an actual pictures of these maps and signages in your facility. Okay? So dili nga inig monitor na mo pay pagpintal sa signages, no? Which is makatawa na lang mi sa facility nga among gi-visit nga maski ang waste bin itapot na lang ang cover sa iyahang trash bin. Okay. Yan na one of their staff niyon pa ay ganina pa magunang buntag gipintalan, sir. No? So maybe makatawa ta but we are violating the standards, no? So again, we are not expecting too much na perfect yun kay nga signages, no? But as much as possible, we have to follow the specific standard of this standards that we have been implementing. Okay, and then there is a process of monitoring the workplace safety, hazard prevention, and control. So there are policies, guidelines describing the processes, no, of the flow of monitoring and inspection in the facility. No, is there a safety and safeguard protocols are in place? Like for example, in the laboratory, is there a biosafety and biosecurity policy being implemented? And then the cabinets of the nurse station, no, the lots of the dangerous drugs and cabinets, no, kinaamon observe po during samong rounds or samong visit. Ang emergency room, ang high alert medications, gitapo ra gyud siya sa mga emergency meds dito sa e-card. No, wag gyud gilak dito niya. In the event nga naay makakuha ana or simba ko masayop ang nurse, that could be a problem within the facility also. Okay, and then next slide. There are also preventive maintenance activities conducted in the hospital, no? So the engineering department knows this more, no? That the inventory of the equipment, infrastructure, vehicle, no? Napay schedule sa atong regular maintenance sa atong and calibration of equipment, infrastructure, and the vehicles are available. So document review ra gihapon ni of the preventive maintenance schedule of the facility. And then the 6 is the hospital and health facilities and services are safe and of quality. So the hospital is recognized as green and safe climate resilience. Mo na among giingon no nga we encourage those facilities nga mag GVA na ta or green viability assessment, no? Using the tool, you have the tool. I think engineer will be the tool, the GVA tool will be provided by Engineer Lord later on, no? Gitagaan naman sa siguro ang mga hospitals. Okay, so it is a certifying body also by the DOH. Now we have to have a green viability assessment in our facility. So we have 5 levels of stars, no? The 5 stars, 4 stars, 3 stars, 2 stars, and 1 star. So I think na mga facilities nga na certified na sa DOH na green facility. So I encourage other facilities to do the GVA tool validation for you to be certified also. Okay, next slide. So this is the last indicator of the iHomes SAT. So it entails about the resource management. So the first criteria, the hospital conducts performance and budget utilization review, or the PBUR, no, in at least once a year or annually. So basically, we'll be asking the document review of the minutes of the meeting and the other supporting documents. And then the hospital conducts unit budgeting. No, so each unit or department or program submits their budget proposal. If there is a budget proposal per budget, supposedly that's coming from the unit or the department itself. No, there should be a budget proposal for the unit. So we will be having a document review on this. If the concerned facility or department or unit has this budget proposals. Okay, and then the concerned departments or programs in the hospital are informed if their budget proposal has been approved. Right, and then document review of the memorandum or any official document disseminating or circulating approved budget. Next slide. And then the hospital conducts review of their costing and the hospital rates and fees. No, the hospital review updates of their hospital rates and fees in accordance with the standards provided in the Manual of Standards of Management of Hospital Finance First Edition. Okay, so nana siya dito sa ito manual. Next slide. And the hospital monitors the financial viability and condition of the facility. No, we have the monitoring system in place and the data are being analyzed. Okay, examples of financial data would include the following, no, but not limited to resource availability, allocation, utilization, the cost recovery, and more specifically, these may include the liquidity ratio, activity ratio, vertical or index data analysis, days cash available, payables index, collection efficiency, and the average age of fixed asset, and the QFS rates, and etc. Okay, so documental review gihapon of the process of the monitoring mechanism analysis report and the utilization of data for planning and decision making. Next slide. So number 5 is compliant to the standard prescribed meal allowance per DOH administrative order number. So the hospital adheres to the prescribed budget meal allowance, no, that is stipulated in the department memorandum. So the also is served with nutritious meals in compliance with the nutrition standards, no. Check the cycle menu if it's made for meals for patients and validate if NDS are standardized recipe available as nutrition standard in preparation of cooking of meals and patients. I'd like to emphasize na other facilities among na visits, luoy kaayo, it's because I don't know, maybe we have to strengthen on the policy on that because nag-outsource sila og diet caterer, and then ang ilang gipakaon sa pasyente is just the normal food that is being served in that certain karinderya or restaurant. So my concern this is the nutritional needs of the patient. So we are concerned with that, no? Because basig si hypertensive patient, the more nga ma-hypertensive ang patient because basig sobra kaparat or salty ang atong food we serve. So might as well we visit the policy on that and to make necessary action with regards to the nutritional value of the patient. And then compliant to the DOH administrative order, the guidelines of the implementation of the nutrition care process in the hospital. Right? Next slide. So there is a monitoring of the wastage from all departments of the hospitals. No, wastage meaning includes the following: reagents from the laboratory, the expired medications, the food wastage, and other medical supplies. So document review of the inventory report and any other similar document reflecting the wastage. And then resources are allocated for the integrated electronic hospital information system, and there are available resources in the hospital which include among the others like computer, hardware, software, and ICT needs like the internet and etc. Okay. Next slide. And the hospital is compliant with the staffing standards. No, so again, the hospital is appropriately staffed, adheres to the standard in terms of the required number of plantilla items for each position title. So the hospital is able to maintain a low percentage of unfilled positions, or not more than 20% of the total number of positions are unfilled. So document review of the filled and utilized positions. So the list of hired job orders and etc. Okay, and next, I think that is the last part of our iHome tool. So I'd like to leave this message that you strive for excellence in healthcare through a relentless commitment for continuous quality improvement, where every process is an opportunity for enhancement, and every patient and experience is a chance to elevate healthcare standards. So thank you very much, and good morning.
Okay, thank you so much, Sir Ryard, for the very comprehensive, no? Introduction naman to, pero more comprehensive kaya na pagka-detailed ang pagka-introduce ni Sir Ryard sa atong new iHome self-assessment tool. So again, thank you, Sir Rai, for sparing time to introduce us the new tool despite your very busy schedule na no, sa imong new section. So for the information of our... Yes, sir.
Permission to speak me. I would like to thank all the hospitals and health facilities. No, I'm grabbing this time to thank all of you. No, I'll try to start my video. All right. So in behalf of HFDU, no, I would like to thank all the chief of hospitals, the chief nurses, and all the staff in the different health facilities in the region. So I would like to thank this opportunity to thank you all, because I'll be endorsing already the program and the section to them, and then I'll be leaving the section already because I'll be actually I was transferred already na, no? I am transferred now to the non-communicable disease section. So I'm looking forward to future engagement with you, and I would like to thank you all because your valuable inputs are very important for us to improve our facility. So once again, daghan kayong salamat, and see you around. And if you have any non-communicable disease section concerns, you may approach or you may call me in my office. Let's help together, no? As much as possible. Taman sa makaya, we will help each other. So thank you, and have a good day, everyone.
Thank you once again, Sir Ryard, for extending your help in disseminating or cascading this new iHome tool to our facilities who are with us today. So for the information of our facilities, we will be cascading the new iHome SAT tool, and we expect the facilities that you will start assessing your facility using the tool. And with that, we are asking the facilities to submit the copy of your assessment on or before March 22. That will be Friday, because by April this year, HFDU will begin validating your submitted iHome tool assessment. Okay, or iHome self-assessment tool. Okay, so at this juncture, the virtual floor is now open to discuss your queries and concern. So you may drop your questions through the link posted in the chat box, or you may scan the QR code. Sir Mark, can you please flash the QR code, Sir Mark, for them to scan? I will just be reading the questions na lang. Okay, for the first question. Okay, okay. Awaiting daw ang uban sa QR code, Sir Mark. Okay, so flash on your screen is the QR code in which you can scan to which you drop your questions, or again, refer the link posted on the chat box. Okay, so for the first question, For hospital client experience survey for private hospital, uh, it is encouraged but not required. However, we also do not want to be among the list of health facilities with no submission. We have our own in-house satisfaction survey. As such, we are running 2 surveys for satisfaction. Can we be clarified about this? Okay, I will be reading the answer from Miss Hope. So per guidelines of the Department Memorandum number 2023-0131, it is true po that private facilities are not required, but they are encouraged to utilize the tool. And I understand that your facility has an existing satisfaction survey. However, other private facilities able to integrate their in-house satisfaction survey to the HCES tool. Some replacing their existing satisfaction survey with the hospital client experience survey tool, and other facilities are running 2 surveys for their perusal and compliance. So, in short, pwede ninyo i-integrate ang inyong existing na survey together with the hospital client experience survey tool given by DOH or mandated by DOH. Right, Miss Hope?
Yes, ma'am.
Okay. Okay, for the next question, can the IPC from Mandaue City Hospital, can the IPC nurse be delegated as disease surveillance coordinator? So, the health facility shall have a ratio of 1 full-time ICN for every 100 bed. If it does not hinder his or her responsibility as ICN, then it can be as long as he or she can perform her responsibilities both as an ICN and an SDO, or DSO rather. However, there is a different training or orientation for disease surveillance. We also have another question from Maria Teresa Esteliore uh, for PHU. Does infirmary hospital require to have one? Because for the policies, only level 1, 2, and 3 were specified. So as per Ma'am Ann, the program coordinator for PHU, yes, infirmary hospital being part of the primary care provided network are required to implement the PHU as per AO number 2020-0019, which specifically state that all public and private hospitals are to implement PHUs. There is a need to be guided with the function of the PHU, which is for patient navigation within the hospital or navigating him or her to the appropriate facility, whether for forward or for upward referral for further management of the patient or downward referral in times of patient discharge. Another function to consider is the monitoring and reporting of the notifiable diseases and the conduct of health promotion activities and our health emergency preparedness and response. I think this is Dr. Deborah Ann Custodio. She just notified us for the new or for the official email of Lapu-Lapu City Hospital. This is noted, Doc. From Miss Angie Kui, can we have the link on how we can see or view the manuals? Actually, the e-manuals has been cascaded long ago and has been cascaded again this year. But for the interest of everyone, no, to make sure that the manual is fully cascaded, we will provide you the link on the manuals. So we will be asking the help of our IT personnel here to help us give the link of the manuals. From Karen Alfefara, good day. I would like to ask who is the right person to call the hospital? Is it the patient's significant other or the referring hospital staff? It is it if this is for the referral,
Yes.
this is Anne.
Okay. Now, the very purpose of our electronic referral system is to save our patients' lives. Now, we have our Central Visayas electronic health referral system. We have our application, which our significant others cannot access to the system. So it is the responsibility of the hospital to refer the patient to the appropriate facility, whether or not the patient was being assessed. No, as long as the patient came to your hospital, then you are responsible to refer that patient to the appropriate facility. I hope it answered your question, Ma'am Karen.
Okay, for the next question from Sir Nino Voltaire Pedida. For hospital client experience survey, for the culture and responsiveness, can you please also include in the list nursing aid, not only midwife, because when patient significant others thought of it as nursing aid but not midwife. Miss Hope.
Yes, ma'am. No? As of now, ma'am, wala pa na-include ang nurses aid sa ato ang survey, no? But we will lobby this to the central office na ma-join sila sa survey as well, ato mga nursing aides.
Okay, next question regarding referral system from Oslob District Hospital. Referral system objective is to save lives and secure quality and continuity care. Pero ug naay referred patients to Soto, taas ang gihapon ang number of patients waiting. So how would we want to address this kind of problem? Thank you.
Now, as being presented earlier, that we have two groups attending to electronic referral matters. Now, we have the technical working group for the assessment pertaining to our applications and our processes. And we also have our health referral committee for the approval of our policies. Now, we are still pursuing the effectiveness in our e-referral system. There are still a lot of hospitals or even individuals, mga walk-in individuals na dito gyud gusto magpa-admit sa Vicente Soto because Vicente Soto is equipped, no? So we have to really impose what is in the healthcare provider network, that we have to follow the classification of cases in referring our patient to decongest Vicente Soto. So kitang tanan, we are responsible enough to check the classification of cases in referring our patient, and also to disseminate to our constituents within our catchment area. Pakabalo naman tanong kung unsay ang ato ang mga responsibilities, unsa na ato mga catchment areas. We have to disseminate to the people nga they cannot just go directly to our tertiary hospital. They have to pass to the healthcare provider network, meaning they have to pass the PCPN or the primary care provider network. Then if our RHU could not do such intervention, then they have to refer the patient to the appropriate facility based on the classification of cases. Kay kung dili jud mo follow ang tanan, then Vicente Soto will remain ra gyud siya as congested facility for the patient nga dili na gyud unta angay for the tertiary patient, for the secondary and primary cases. So kitang tanan, we are responsible enough to disseminate to our catchment areas, to the constituents within our catchment areas nga dili na ta pwedeng mo diretso sa Vicente Soto. Kay si Vicente Soto, whether he likes it or not, ilang yun ng tagaag primary intervention nga makakos sa congestion of beds. Limited man ang beds sa ato ang Vicente Soto. So we are encouraging everyone yun to do our job of disseminating. I hope it suffices, Oslo District Hospital.
Next is from East Medical Center Bayawan. Good morning. This is from East Medical Center Bayawan. We were able to implement and submit the hospital client experience survey. Okay. I'm sorry. So from ACE Medical Center Bayawan, good morning. We were able to implement and submit hospital client experience survey for year 2023 for clarification.
Yes po, upon checking to the system, na-recorded na submission.
Okay, this has been noted for ACE Medical Center Bayawan. Okay, from Ma'am Bibian, for organizational structure for private hospital level 1, where should we base our organizational chart or structure? Can we ask for a template? Sorry, I was not able to understand it accurately because it was said that it is only for government hospital. Please correct me. If we would like to verify, ma'am, you're referring to the iHome tool, right? The one asking for the organizational structure.
Ma'am.
Yes, Ma'am
Yes,
Bibian.
ma'am.
Oh, okay.
Yes, I am referring to the iHome structure.
Okay, Miss Vivian, we will provide you the link or the for the organizational structure per private hospital level 1. Okay. Thank
Thank
you.
you, ma'am.
Hello? Am I loud and clear? Okay, for the next question from Sir Nino Voltaire Pededa, is it necessary to have iHomes committee or can we integrate it with other committee? Hello, so as per the new iHome tool, no, it is very necessary to have an iHome committee to oversee the integrated hospital operation management in our facility. But I believe that some facility they have limited personnel, no, so you may uh, integrate it with other committees as long as they know the roles and responsibility as being part of the iHome committee. Thank you. Another from Sir Nino Voltaire Pededa, need ba jud himuan og i-referral ang patient bisan wala na admit or consult and dili dayon kay mahalan ra sila? The next problem is dili baya mabasa dayon sa receiving hospital mas madugay ang pasyente. Miss Anne, can we address this one please?
So the situation is the patient, I just want to clarify the situation, ha? The patient went to your facility, sir, and then...
Hello, ma'am. Nino here, ma'am.
Yes, sir.
Ang question
Sige, sir.
is kadang ang patient ning ato sa kuan nagpa-check up na consult ing ana then advice, let's just say advice kuan siya for admission and dili siya mudayon kay pero kung ang patient stable ra dayon di siya mudayon kay mahalan na siya di siya ka-afford. So ang question is kanang pa bang himuan yung i-referral ay bisag ang patient wala siya na admit unsa kay or if wala po na consult ning anang kuan lang ba ning adto kay and ang problem gud na if maghimuan namo po is ang receiving facility di ba diya mabasa biya dayon ing ana so mas madugay
So
ang
ako lang
patient.
iklaro na ko, sir, ha? The patient is stable, not in emergency.
Pero na, let's just say, ang iharang quad is, let's just say, Sibra yung vital signs in for kalan siya. Let's just say, kanang cough and fever, pero yung vital signs stable ra.
Okay, sir. Now, if it passes to your facility, then you need to refer to the next appropriate facility. So, kung mingon ta next appropriate kay private hospital ni sir, no? I believe it is Mactan doctor. So,
Yes
ang
po.
patient has the right to refuse for treatment because of the cost of the treatment. So, gusto sila, sir, magpa-refer. Like, for example, sa ato ang sa mga appropriate facility, level 1 facility, for example, for infirmary, kung na-enroll diha. I-refer yun gihapon nato, sir, to facilitate sa atong patient nga ma-admit in that particular nga hospital.
So, yes, mag-ibig ang i-referral, ma'am, na yun, ang problem is, like, kasakar man, dugay mabasa, dugay makuan, so ang pasyente, magpaabot, or sa man, patula pasyente, dahil mo na lang i-referral.
Kuan siya, sir. Ang atong
sabi sa ma'am, naman sa doctor to doctor endorsement, ng ana, and ano, maguhat pa ang pasyente, kilo iba po ka pasyente, napatuna to, nag-amo dito, wa pa di ay, ang pasyente mo piluoy man po ba?
So, sir, in cases like maghulat, no, in times of maghulat, we have the 711 to facilitate the referral of our patient. So, mutawag lang siguro ta sa 711, sir, for them to facilitate the referral to whatever facility nga imong i-refer. Basta, ato dyan ipahilo na atong patient, sir, sa appropriate facility.
So,
we are still...
Sila, ma'am, mana sa ay na lang, walk in na lang may dito, mana sila.
Dili siya pwede, sir, kung mo-walk-in sila specifically if they are going to choose Vicente Soto because we have to follow the healthcare provider network. So, dati mga classification of cases. Nanda mo i-copy sa itong classification of cases, sir. So, naato kung unsa lang ang mga cases for level 1, for level 2, and level 3 hospital. So, dili na, before, pwede manggutang mingon, mato lang ko sa Vicente Soto dayon. For now, dili na. Kay the more, dili siya maatiman. Kung iatiman man gani sa itong Vicente Soto, ma-congest sila ang mga tertiary nga cases, di na hinuon matiman sa itong Vicente Soto. Mo itong problema sa itong Oslo District Hospital.
Okay, sige. Thank you, ma'am. Thank you for that.
Okay, you're welcome.
Ma'am Ann?
Yes. Yes, ma'am.
Good morning, Ma'am Ann. Karen.
Yes, good morning, ma'am. Karen.
Ma'am Ann, kanang additional lang sa question with regards to Sir Ninio ba? We also encountered that kind of incident. And then the patient would like to sign na lang as kanang hama na lang bitaw siya sa amo, Ma'am Ann. And then we don't know that they went to, let's say, Apex Hospital, Soto. Nga tawagan mi sa Soto, ma'am, nga wala mi nag-i-referral, nga gikan sa amo ang patient. Pero hama siya sa amo ang status. So dili gyud siya na mo refer kay hama man siya.
Yes, ma'am. I understand your situation, ma'am. So there is really a need, ma'am, Karen, to explicitly you'd explain to the patient na hama siya, pero if na siya interest nga magpa-refer, no, dili na siya maghama. No, i-refer ninyo to the next facility. So, mura siya, it's just a matter siguro, ma'am Karen, of our thorough explanation to our patient. Kaya sometimes, man good, we are being confronted with lots of problems siguro, dilemma. No, one, financially. Second, unsa ang mga measures nga they are not being informed to the processes. So maybe we are to thoroughly inform them na siguro, ma'am Karen. Nga, unsa ba na ba mo'y intention pa nga magpa-admit sa laing facility kay kuna dili mo dawaton didto. Not unless among i-refer.
Sige, ma'am. Okay, ma'am Ann. Then, katong sa question ako ganina, ma'am Ann, ba, kanang with regards sa calling bitaw sa i-referral, kay usually, maka-receive yun ni ang referral, the call would come from the significant other from the patient. Dili, diretso from the referring facility. So ang SO na noon may manawag sa mua kung doon na ba may available nga accommodation unya basig maingna namo ba nga wala niya kanang mabalibaran namo kay lahi man gud na og kanang ang facility gid ang manawag, Ma'am Ann.
Yes, ma'am Karen.
So,
I understand po.
So it's really the facility will call.
Yes, ma'am Karen.
Okay. Thank you, Ma'am Ann.
Okay, you're welcome.
Okay. Thank you, Ms. Anne, for addressing their concern. So for IPC and healthcare waste management, Is it mandatory to create a separate organizational structure for this IPC and Waste Management Committee?
Okay, so for IPC, there should be a on healthcare waste. There should be a separate IPC or organizational structure for IPC and waste management because those are two different committees. If there is an issue on sa personnel, pwede na to magbalik-balik because this is just to see if all concerned departments are well represented. Amo ang gikuan ang organizational structure because some health facilities during the monitoring, sometimes ang isa ka member is dili sila aware that they are part of the committee. The committee is very important. They are aware that they are part of the committee because they have responsibilities to roles and responsibilities to perform. For example, the ato ang pag review sa ato ang policies and procedures. This review of policies and procedures is not solely the work of the infection control nurse or the health ato ang PCO, but as well as it is the shared responsibility between the committee members.
Okay. Okay, thank you, Miss Sally, for addressing that. So we have it's not a question but rather a suggestion from Lapu-Lapu City Hospital. E-referrals, maybe we can set a separate venue and time for an in-depth discussion so all stakeholders address the issues if it's okay with everybody.
So, yeah, we are happy for this suggestion or recommendation. Now, we will be presenting this to our TWG and our Health Referral Committee. Then we are going to do this separate venue for an in-depth discussion of our referral para dili na bitaw magbalik-balik ang surfacing issues nga pariha ra gyud gihapon. So very good suggestion or recommendation. Thank you for this.
Okay, next one to clarify, for private hospital is on September 2024. I believe it was pertaining to Engineer Lord's discussion a while ago.
Hello? So, included ni ganiya sa ako ang presentation. And to inform lang po everybody nga the tool is nakascade na ni siya last February 2. So, for the reference sa katong mga selected government hospitals. So, pag February 2, nakascade na gid ang atong tool para sa reference sa itong GVA tool and also the submission. Okay? Thank you.
Okay, next question. Good morning po. Free ba ang iHome system kung private facility mo gamit, ma'am, sir? Yes, iHome is free, but kindly send a letter of request addressed to Director Jaime S. Bernadas for your intent. Okay, next question for Sir Ryard. Ang iHome committee composed of medical and non-medical heads or members? Do we still have Sir Ryard on board, or if I may? Okay, so for iHome committee, since this is an integrated hospital operation management program committees now, yes, the committee should be composed of medical and non-medical. So if you look at the iHome tool, no, it doesn't only focus on the medical aspect of the operations, but also the non-medical side, like the engineering department. So I might as well have them as member of the iHome committee. Okay, and then next question from Galiares Celestino. What is the turnaround time of answering e-referrals? Miss Anne?
Okay. Now, as per guideline, it was not being stipulated the turnaround time. But again, we have to consider that all referrals, no, specifically the urgent case, we have to answer it immediately. That's why there is a person yun, no, responsible for our e-referral, kinsa na dihang naka-assign to answer the call or to answer sa ato ang electronic nga referral. Now, I really appreciate this during that time when I submitted for check-up or for katong sa emergency situation ang ako ang daughter-in-law, no? Nga we coordinated with Eversley and Eversley consulted our patient niya. Accordingly, it is not within their service capability and Eversley really find time, no? Nag-sit down yun siya to call, ang doctor yun to call the patient, the referral facility. Kanang, it is the responsibility of the referring facility to coordinate closely with our referral facility. Meaning, kung dugay sila mo reply sa atong message, then we have to call them. No? Kung di nato sila ma-reach, no, with our call, then we have to call our 711 because 711 can also coordinate with them. So sa atuang guidelines, it states there that there must be close coordination among facilities to effectively refer our patient. Kay kung ato nang pasagdan nga naka-type na bitaw ko, naka-refer na bitaw ko, without calling them, without calling the referral facility and the 711, then useless ang ato ang program, useless ang atong implementation, useless ang atong intention to help our patient. So immediately dapat atong i-answer yun ang ato ang referral. Mr. Presto, do you have follow-up question?
No, this is Dr. Presto. I'm good with that, ma'am.
Doctor.
But again, there has been a note because I, for one, I had an instance that we referred patients down in the south of Cebu because I was in Cebu in that time. And that, yung pasyente ayaw nang mag-antay because of matagal it took about 30 minutes already but no reply yet. So ayun, that's the reason why they opted to go to a higher center. And
Doc,
thank you
if in
for
case,
your reply.
yes, Doc, if in case, gali, Doc, that you cannot, there was no reply coming from the referral facility, then you can make use of our 711. Kaya naara jud sila, Doc. May tao talaga to contact with the referral facility.
Thank you for that, ma'am. But in the case of in Bohol setup, we still have to establish those things. But this is duly noted for us to improve more in our healthcare delivery. Thank you.
Okay, thank you, Doc.
Okay, from Vicente Soto Memorial Medical Center, can you reiterate the submission of the iHome SAT? Thank you. So again, submission of the Accomplish iHome self-assessment tool is on or before March 22, 2024. Because by April, we will be beginning to facilitate the validation of the submitted iHome self-assessment tool. I hope that is clear. Do we still have other questions? Okay, Ma'am Anne.
Now, speaking of the submission of the iHome self-assessment tool, maybe you are confused as to the guidelines. If you have read, it is on the third quarter of yearly submission, but because of the number of facilities that we are to validate, so we have to make it as early as March 22, 2024.
Thank you, Ma'am Anne. Okay, do we still have other questions? Okay. So I think we don't have any other more questions. So if you have questions in mind, no, later after we have this teleconference, you may coordinate with us through our local number 032-260.
Question, ma'am, ang Ricardo.
Yes. Okay. Yes, from Ricardo Maningo. Yes, the
Yes,
floor
ma'am.
is yours.
Ganihara mi gataas og kamot, ma'am. Wa magid
Ah,
makita ni mong kamot
okay,
dinhi. So,
sorry.
nitingog na lang ko.
Apologies, sir. Okay, yes, please.
Ma'am, ang amo lang concern is kaning sa referral system ba? Since isla man ang kamutis, naami mga emergency cases nga referral usahay. Unya, kana bang isyu nga dili pa ma-accept sa among gi-referan. Unya, amo nang ipalarga kay gi-declare sa doktor nga emergency. Unya, manawag mi ana sa 711, ang 711 sad mo question sa amoa kung natawagan na ba ang katong hospital of destination.
Okay.
Yes.
So as per ko ano, we still have a lot of dilemma gyud to solve with our e-referral to make it effective. So that was a very good recommendation, no? Coming from the participant that we have to have thorough gyud siya, no, with the 711, with the referral facilities, the apex hospitals, tertiary hospitals, secondary hospitals, so that we could be able to have meeting of minds, no? Unsa ba jud? Unsa ba ning 711? Can you refer? Can you call our kuan? Pero kung nag-input lang siguro mo, sir, no, siguro maybe the concern of 711 is the inputting of the kanang vital bitaw nga information to the referral facility kay 711 cannot do it, no? Mas kamo in the position to input sa i-referral nato kung unsa ang mga vital nga information of the patient, no?
Yes, ma'am.
Particularly on the initial intervention. So maybe mo lang siguro na ang point, sir, of the 711. But to
Yes, ma'am. Yes,
clarify,
ma'am.
to clarify yun sa ato mga respective roles, then we can have to have this kanang one time na to nga meeting, no, on how to effectively implement electronic referral. Kay para ma-plancha nato, no, you try to kuana this time on sa inyong mga questions for e-referral para right there and then we could be able to meet our minds together and be effective in the implementation of this program. So, ana lang siguro, sir, I cannot speak for and in behalf of 711 unsa ba jud ang real situation and also for the referral facility, but ang need jud ani siya, sir, for the 711 is for the referring facility to input, no, the necessary information nga naa sa tong electronic referral para sila na mo refer to the referral facility telling them nga naa na ang mga necessary information sa ilahang sa electronic referral.
Yes, ma'am. Ang kanang sa 711, ma'am, unsa man na sila mo oversee lang sila sa traffic sa mga referral. Kaya ang concern magud mo dire sa isla, ma'am, is kung doon na may mga pasyente nga for emergency referral. Kay isla baya may it take 2 to 3 hours to travel unya dili da ni accept. So ang tendency naghimo ang among hipi dire og protocol nga once declared emergency amo nang ilarga bisan pag wala na accept. So by that time, among tawagan ang katong hospital of destination, among inform at the same time among inform pod ang 711 nga among gipalarga bisag wala pa gi-accept online.
So this is also another scenario, sir, that we have to meet our minds together, no? Kung
Yes,
pwede
ma'am,
ba na siya, no? Kay ang atong kuan jud siya is for the referring facility to coordinate closely with the referral facility. So kung wala pa'y signal kay ngano man ang atong usapod ka ni ka reason, sir, is for the referral facility to also prepare, no, for such referral. So ato ni siyang planchahon siguro, sir, no? So we are going to present this matter to our technical working group. We will be having our meeting on the 13th day of March. So this will be presented, how we are going to treat this, no? Kani nga mga dilemma in referring
Yes,
our
ma'am, kay
patient.
basin og naay need nga special consideration, ma'am, ba labi na sa mga hospital nga nasa isla.
Yes, sir. Yes, sir. So nakasabot jud minimo ana, sir, and we are going to present this matter, sir, to our technical working group and our health referral committee. And after that, mag-meeting na dayon ang tanang mga hospitals for our e-referral nga concerns.
Sige, kopya, ma'am. Thank you kay ma'am.
Okay, you're welcome, sir.
If I may also add, no, good noon, everyone's apologies nga we murag may exceed ta sa time. It is also already 11 minutes past 12, no, pero I'd like to encourage everyone, even if as of this time daghan pa kay issue atong i-referral nga system, no, it is not nearing kanang murag what it should supposed to be ba kay pero as much as possible, we have to utilize the e-referral system. Why man nga there are mga referrals nga dili ma-accepted sa mga higher nga mga facilities and even our apex hospitals because there are cases nga na cater dito sa ato ang kana nga mga facilities nga supposedly not for that particular facilities, no, mapuno sila mo na nga ang atong emergency cases nga we refer to the apex na-accept nila kay naay mga walk-in dito sa ilahang facility, na-accept nila supposedly dili to para ilaha para sa lower nga facilities pero ni walk-in man mo to naka-occupy sa ilang mga beds nga supposedly unta for emergency and mga special nga mga cases, no, so mo na nga I'd like to encourage everyone, we have to use the e-referral system even if it is as of this time not perfect pa, not very well established pa, no, para ato ang mahimo bitaw natong practice nga ang cases is being referred appropriately where it should be catered, no, or managed, no, so for those nga mga cases nga should be managed only to the level 1 hospitals adto ra nato sila i-manage, so come a time na mura bitaw na institutionalize na nato ang implementation of the e-referral nga kung unsa ra gito nga cases nga atong i-refer sa kaning apex adto ra gyud mao ra gyud ang maabot didto, no, sa level 1, sa level 2, no, sa level 3 kay para dili na maghuot tanang cases dito sa Soto, mao na nga ang atong mga emergency cases or katugid untang mga cases nga mag-need of specialized care dili na hinuon ma-accepted, no, kay tuwa naman dito ang maski mga minor nga mga cases, no, so I hope you appreciate the importance of using the e-referral, and yes, the kanang relevance of the hashtag 711 also is only to facilitate the referral that is made through the system, the e-referral system. So if ever inyong ma-view dito nga di wala pa siya na-accepted sa facility, please do take time to call the hashtag 711 kay sila ang mo-facilitate through calls also nganong wala pa na-viewed or na-accepted ang inyong referral. So maka-facilitate ra siya. Pero there are really times, no, we apologize nga na a lot of delays considering that puno gyud ang mga facilities nga atong referanan sa atoang patients. So apologies for that.
Thank you, Doc Sha, for explaining well the. Yes, Ma'am Ann? Okay, so we have an additional question. Can we refer back patients from level 3 to appropriate levels of healthcare facilities like level 1 or 2? I think the person is referring to down referral.
Yes, Dr. Presto. So we can refer right after giving initial interventions to the patient. Then we can refer them to the lower facility.
Okay. Thank you. So we have representatives here that raise their hands. Katigbian District Hospital. You may sound up po if you have question. How about from Diparini Hospital?
Thank you.
None? Okay. How about Diparini Hospital? Okay. How about Ma'am Idnalyn Tenyo? You are raising your hand, ma'am. Do we have a question? Okay. How about Mindero Medical Center? So for the interest of time, no, because we've gone beyond the expected time na ma-end ang atong telecon. If you have any questions na later ma-identified nyo, you may call us at 260-9740, local 441, or you may email at us hfds@ro7.doh.gov.ph. Okay, at this juncture, to give us the closing message, may we welcome on this virtual platform the newest member of Health Facility Development Unit, our Medical Officer 3, Dr. Margot Papasalcontin.
Hello, can you all hear me? Is my audio good? Hello? How about that? Is it good? Okay. Ayong udto kanatong tanan. So I hope everyone is still alive. I know nga lapas na gyud ta. And to all my esteemed colleagues, no, salamat kaayo sa inyong pag-join ani ato ang first quarterly teleconference for this year. So we are reminded, no, of the profound significance of our work in advancing the Department of Health's 8-point action agenda and towards the implementation of the Universal Healthcare Law. So today, through our discussions and collaborations, we have reaffirmed our commitment to these critical priorities, each of which serves as a guiding beacon in our collective efforts to improve healthcare delivery and promote wellness in our country. So with the various program updates under the HFDU, we have centered around strengthening the very foundations of our healthcare systems. We have encountered problems along the way, but this is to ensure that we will have a robust, resilient, and responsive to the needs of our communities. So through our updates and presentations, we have demonstrated our unwavering dedication to enhancing the quality and accessibility of healthcare services, reaching even the most underserved populations. Okay, our discussions have underscored the critical role of our healthcare workforce, emphasizing the need for continuous training, support, and capacity building to ensure they are equipped to meet the evolving needs of our healthcare landscape. So we recognize the importance of data-driven decision making. So that's why we have provided, the Department of Health has provided a lot of tools for us to utilize. Okay, and we have explored ways to enhance our health information systems. Okay, later on, we will be introducing the telemedicine. So ensuring timely, accurate, and comprehensive data for informed policy and program development. Moreover, in light of the growing threat of climate change, we have looked into strategies and tools to mitigate its impact through minimizing the carbon footprint of the health sector while continuing to provide safe and quality healthcare to the people. As we sign off today, let us carry forward the spirit of collaboration, innovation, and commitment that has defined our discussions this morning. Let us remain devoted in our pursuit in achieving our objectives, knowing that each step we take brings us closer to a healthier, more resilient future for all of us. So thank you once again for all your unwavering dedication, passion, time, and contributions. Let us continue to inspire and make a difference in the lives of those we serve. No, daghang salamat ninyong tanan ug maayong udto.
Thank you, Doc Margot, for that very uplifting and encouraging closing remarks. I bet all the health facilities are already excited to meet you in person and join with you in the upcoming hospital activities and engagement towards the provision of quality healthcare services. So at this point, we would like to ask our participant to please turn on your camera for the photo documentation of today's activity. So, kindly please turn on your camera and flash your warmest smile. I know gigutom na mo, pero smile tataka diyot mga ma'am, sir, doc. Okay. So, sir, okay, in 1, 2, 3, smile. Next batch. 1, 2, 3, smile. Another. 1, 2, 3, smile. Another one. 1, 2, 3, smile. And last batch, 1, 2, 3, and smile. Okay, thank you for flashing your warmest smile. Bisag gipang gutom na ang tanan, no? Okay, so we would like to hear from you, Sadno, on how to improve our services. So we will be flashing on your screen the QR code for the evaluation. So please do scan that or click the link posted on the chat box for the evaluation. Um, so please be guided on the links posted on the chat box, please, as well as posted on the screen. So we would like to ask everyone no, to please make sure you have registered your attendance, and you should also evaluate. So the identified ones, we will be able to cascade the copy of the presentations. Thank you so much for attending today's virtual activity. Again, please know that we value your presence and continuous support for safe, high quality, and compassionate healthcare delivery services. So this has been your moderator, Ms. Jeremy Arangas, signing off. Thank you and God bless.
siguro ba? Na. Ricardo L. Manido. Asa mo